Child Protection to order. Just want to thank everyone for being here today. We have a full agenda today. We have, I think on my side in the House, we've been trying to pull this legislative task force together for the last year and a half. So because of conflicts and committees and other things that have happened, we just was not able to do it. And so here we are today. So I'm glad that we're finally able to pull the task force together and bring in folks from out of town to really give us a state of where we are in the 21st century around the child welfare system. So my name is Rena Moran, State Representative from District 65A. I represent the St. Paul community of the Rondo, Falltown, North End, Midway, a little part of Cathedral Hill. And what I would like for us to do, I'm one of the force in the House, and I'm going to pass it on to the other co-chair in the Senate to do introductions, and from there we will go around the table. Today I happen to have the gavel because the last time we met in 2018, the Senate had the gavel, right? And so I look forward to this meeting. I look forward to a productive meeting. I look forward to you learning, hearing, and also sharing information about how we can move our state forward. So thank you all for being here.
Good morning. I am Senator Julie Rosen. As Representative Moran said, I'm the co-chair with her and honored to serve with her on this and all the members. This is a very important task force. It's probably one of my favorite, actually, outside of pensions, believe it or not. But we have done a lot of work in this area. And actually, I served with Senator Kathy Sharon, and I were the first senators to serve on the task force from Governor Dayton's appointee way back. That was a long time ago. I can't even remember, actually. And it is a long time coming. We have a tremendous amount of work ahead of us, whether it's dealing with foster care or making sure that family assessment works or the African American Family Preservation Act. We have a lot of work to do to go ahead. So it's methodical. We want to make sure that everybody has a voice and we get it right, because in the end, it's all about the children. So again, thank you, Representative Moran, and we will be having another hearing, hopefully shortly after this one, within the next couple of weeks, and we just need to get it scheduled. So thank you.
So why don't we go around and members introduce yourself?
Good morning. My name is State Representative Lisa Damath, representing District 13A, portion of Stearns County. Communities include Cold Spring, Rockville, Richmond, Paynesville, Kimball, Eden Valley, St. Joseph, Avon, and a number of surrounding townships.
Good morning. It's an honor to be with you today. My name is State Representative Ginny Cleavorn. I represent Plymouth. I have served as a guardian ad litem for Hennepin County, and I just want you to know that I believe that always the best interest of the children is my driver, and I was happy to stand with Representative Rena Moran when she introduced the African American Family Protection Act. So thank you.
My name is Jasmine DeMiglio. I'm Representative Rena Moran's assistant.
Chris McCall, Committee Administrator for Chair Moran on the HHS Policy Committee in the House.
Good morning. I'm Senator Mark Johnson, Senate District 1.
Good morning. Priyanka Primo, Senate Counsel.
Pat Oswald, Senate Counsel.
Thank you. And we'll let other members introduce themselves as they come in. So I'm going to try to do a short reflection of where we came from and where we are to now. In 2015, 16, maybe somewhere around there, a little boy by the name of Eric Dean was murdered by the hands of his, I believe, his stepmother. And from that, there was an outcry, and the governor created a task force. From that task force came out, I believe, like 91 recommendations. Some of those recommendations have been implemented, some are still in the process, but what we have learned from that time, from moving from the governor task force to a legislative task force on child protection, is that we've had a large number of children come into the foster care system. A disproportionate number of African American children and Native American children have come into the foster system. We have, because of that disproportionate number of children into the system, we have saw a lack of foster parents being available to those children when they need them. We've also seen a large amount of social workers either retiring or quitting and just trying to recruit new social workers into the field. And from that, you know, many would say that we have, and this what the system did was create a really punitive system where kids were being removed and not placed with family, but often was placed with others, foster parents and strangers in the community. And sometimes kids were removed from their community. And so what I, as the co-chair who had the gavel for this hearing, decided to bring people in from the Casey Foundation to look at what we would call reimagining the child welfare system and what do a child welfare system looks like in the 21st century. I'm excited to have them here today. They flew in from, I believe, from Washington to be here today. And so I would like to call Christine Calpin. Welcome, Christine.
Thank you.
And thank you so much for taking the time to fly in from D.C., representing this Washington State, representing the Casey family. And I would look forward to your presentation. So please introduce yourself for the record, for the members.
Sure. Good morning. Oh, apologies. Good morning, members of the Minnesota Legislative Task Force on Child Protection. My name is Christine Calpin. I'm the Managing Director of Casey Family Programs. We are the nation's largest foundation, headquartered in Seattle, Washington. And since 1966, we've been a provider of services to families and children. And currently, we work with child welfare agencies in all 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. We also work directly with over 16 tribal nations and have an incredible presence here in Minnesota. And I'm joined by my colleague, Mike Scholl, who works directly with the Minnesota Department of Human Services. I want to thank you for extending this invitation to Casey Family Programs. It truly is an honor to be here with all of you. I do come to you from Washington, D.C. I work out of our foundation's public policy office. And it's where I live with my husband and my 2 children, my son Henry, who's 12, and my daughter Elizabeth, who is 10, going on 21. And I've heard it said that it's your experiences that shape who you are. And being a wife and mother is without a doubt the most rewarding experience I've had in my life and has shaped me in more ways than I could ever convey. My children, in particular, every day provide me with the gift of being able to see what's truly pure in the world and what's possible. In fact, I asked my daughter what I should say to all of you today. And with her beautiful eyes and her big smile, she looked up to me and she said, "You should say, 'My name is Christine Calpin and I don't want to be here today.'" So let me clarify. I very much want to be here today. But to my daughter, when I'm away from her, it feels like a lifetime, even if it's just a 24-hour work trip, to have this really important conversation. But I also know how absolutely lucky I am that when I return later this evening, both of my children will be there to hug me, welcome me home, and that unfortunately, for too many parents, that's just not their reality. I'm thrilled this task force is willing to listen to all of us here today about what we might do to reimagine this system and think about making this a reality. And I believe this is at the core of what our system should look like. In Minnesota, between 2010 and 2019, there were over 63,000 children who entered foster care. If nothing changes, an estimated 66,000 children will enter foster care in Minnesota over the next 10 years. In Minnesota, between 2010 and 2019, there were 4,167 children who aged out of foster care, which means they left the system with no family and no permanent connections. If nothing changes, there could be just over 4,000 children aging out of foster care in Minnesota over the next 10 years. And in Minnesota, since 2010, there have been at least 157 children who have died from abuse or neglect. As recent data, unfortunately, are showing this number is increasing, if nothing changes, there could be at least 350 children who die from abuse or neglect in the state of Minnesota over the next 10 years. I share these data because I believe it's critical that we know what our inaction could mean for families and children in Minnesota. There's nothing more important than ensuring a child is cared for in a loving, safe environment. And it's the responsibility of everyone to do all that we can to be sure this is the reality. When Jim Casey chose to invest his resources in UPS and create our foundation, he did so because as a business person, he recognized that his best employees were young adults growing up in stable, intact families. And during the more than 15 years we've operated with these resources, we've focused our support and our financial investments to ensure just this. At the core of everything we do is a simple belief. We help children by helping their parents. The act of removing a child from their parents is traumatic. It may be necessary, but it cannot be the only option we have in our toolbox, and it absolutely should be an option that we use as the last resort. Foster care is not the panacea. Data tell us this, the parents impacted by this system tell us this, and the youth who have grown up in foster care tell us this. The federal government spends $7 on foster care for every $1 we spend on prevention. And we see similar funding imbalances in every state, such as Minnesota. What baffles me is why we continue to fund the system we structured to support foster care and expect a different result than what we have, which include children unnecessarily removed from their families, as well as youth who age out of foster care, less than half of whom have high school diplomas, and an unacceptable number of whom will experience homelessness or end up in our prison systems. We can decide today to expect something different, to fund something different. And I hope that help everyone make that choice to structure the system differently, to be focused on families. We help children by helping their parents. So how do we do that? First, we recognize what we all know. Being a parent is the hardest job in the world. Every family is a dysfunctional family. We all, as parents, will experience bumps in the road. However, for some of us, those bumps become mountains, and these parents need help. In Minnesota, approximately 84% of the children who enter foster care do so for a host of reasons that we group together and call neglect. In Minnesota, like every state and tribal nation in this country, children enter care because their parents struggle with substance abuse and mental health challenges. But for some reason, we believe the best way to help every one of these parents is to remove their child. Substance abuse is a disease, and as a society, we've come to recognize that with treatment and with support, individuals can face this disease and live a long, healthy, fulfilling life. If we know this is possible, then why do we see this long, healthy, fulfilling life as one that does not include their children? We have the opportunity to create and fund evidence-based programs that allow parents who struggle with substance abuse to remain with their children for healing and for treatment. And this healing and treatment is not only for the parent, but also for the child. No one is recommending we allow a child to remain in a situation with no support and where there's a safety concern. But it's critical that we recognize that foster care is not a support. We also must recognize that the Child Protection Agency is not structured or funded to provide the majority of the support and services these parents need. Child protection must have their substance abuse and mental health agencies as their partners. And in your role as policymakers, you have the ability to support and expect this type of partnership. And similar engagements are necessary in so many areas. Lack of housing or housing stability is a common reason families will come to the attention of child protection. But again, child protection is not structured or funded to provide housing. Lack of transportation, child care issues, the challenges go on and on. If we know parenting is the hardest job in the world, then let's structure a system that doesn't penalize every parent who struggles, but rather works to encourage and supports them. A system that allows the mothers and fathers of these children to continue to play such an important role in shaping and ensuring their child's future. Why will this succeed? Because the reason parenting is the hardest job in the world is because the childhood years are the most formative and important years in your life. Dr. Jack Shonkoff and his team at the Center on the Developing Child at Harvard have done countless articles and research studies reinforcing this fact, that what happens to children in the early years will absolutely shape the architecture of their brain. Foster care is traumatic. Separating a child from their parent, in many instances their friends, and moving them to a new school is traumatic. This stress and anxiety should absolutely be avoided whenever possible. So how do we do this? The team at Harvard suggests policies and services that focus on 3 key areas, which I offer to all of you for your consideration. The first, supporting responsive relationships for children and adults is the most important factor in early development. When our policies support a parent's ability to be sensitive and respond to their children, whether it be when they are upset, scared, or just beyond themselves because they cannot find that favorite comforting toy, it builds a strong foundation in later years. And when we unnecessarily place a child in foster care and prevent these opportunities, we are breaking that bond. The second key area is to focus on strengthening core life skills. When we're babies, this means helping us to pay attention and follow simple rules so that when we are adults, we can manage our work and meet deadlines. And the third key area is to reduce stress in the lives of children and families. I had the privilege of hearing Dr. Nadine Burke, who is the Surgeon General in California, discuss the impact of stress. And I'd like to use her example to really highlight how detrimental this stress can be to our children. Imagine going through a forest, looking at the beautiful trees, walking, enjoying everything around you, and coming face to face with an enormous bear, right? Your fight or flight is going to come to save your life, and you are going to run. And stress is intended to allow you to have that response. But once you're safe, your body will go back to functioning normally, and you'll go about your walk, albeit in a completely different area of the forest, most likely. Now imagine the stress your body would face if you were to see a giant bear on a daily basis. Right? This constant stress, also known as toxic stress, will deplete the ability of your brain to develop in a healthy way, which will affect you for years to come. We as parents do absolutely everything we can to protect our children from what we struggle with and hope they don't see it. However, we also know our children are incredibly observant and they miss nothing. They may not see this stress, but there's little doubt they feel it and they will experience it. And it will affect their brain development. So what do? We help these families by reducing barriers to basic supports. Food, housing, medical care, mental health services, and we work to provide the access to these needed critical services. It should not surprise us that it's the lack of these supports which create a stressful environment. And it's what leads families to end up asking for help, and for that help to sometimes bring them to the attention of child protection. There's very little that will make someone feel more vulnerable or helpless than asking for help. and it takes such courage to admit you can't do something or that you can't provide something. Because it takes only that one time when you turn to someone for help and got a really negative response to impact everything, it's so important that we shape that experience in a productive way. Early intervention is so critical to everything that we do. Our systems must be structured and funded to allow families to come forward and our workers to champion and support these families the best they can, and to have what they need to encourage and respond appropriately when these families do come forward. It's tragic, however, that when families ask for help, for too many of them, because we lack the structure and funding, the help we provide is foster care. As policymakers, time and time again, I'm sure you have seen studies which show that when you intervene early, it's far less expensive than when you intervene at a later date. In healthcare, I believe this is why CVS has minute clinics and why more and more communities have urgent care centers. Hospitals have recognized that if they provide a different option than an emergency room, families will go there if their needs will be met, allowing the hospitals to better serve the sickest patients in the emergency room in a much more cost-effective way. Isn't that what we should strive for? Imagine a child welfare system that recognizes every family struggles in a different way and will require a different response. A system that's not one size fits all. And most importantly, a system that will actually make the families and children it touches better and safer for having reached out. Today, that's not what foster care is. States, given the funding challenges and structures, have too many children in foster care who should be with their families. The children suffer, the parents suffer, and our communities suffer. And more so, this impacts how we can serve those children for whom foster care is the right place. If only children for whom we could do nothing else to ensure their safety were in foster care, this system would have fewer kids, could serve them more appropriately, and could move them in a much more timely way to permanency. It may be the case that a child should be in a temporary foster care placement, but it absolutely should not be the case that foster care is where they spend all their childhood years. So what does that mean? It means we fund foster care when it's necessary. And at the same time, we fund support services and prevention services that meet the needs of our families. So caseworkers in the workforce who are in the best place to see what a family needs can actually help them. We do our families and our children an enormous disservice by only tying funding to labels. There's no question that a child labeled as being in foster care qualifies for certain benefits that children who are not placed in foster care cannot get. And this also goes for their parents. Fortunately, and I know other speakers will touch on this today, after years and years of debate and discussion about these results, the federal government has provided important resources to support this initiative. The Family First Prevention Services Act will allow Minnesota to receive foster care funding and at the same time receive federal funding for prevention services they provide to families who are in need of help, allowing the children to remain at home. This new federal funding was available beginning October 1 of last year, which means as soon as Minnesota submits their plan to access these resources and it's approved at the federal level, this brand new federal money is available. And additionally, alongside that law, Congress passed and the President signed in December more legislation that provides even more one-time funding to the states to focus on activities and investments that align with this upfront family focus. These increased federal resources provide enormous new opportunities, and I believe our time is now to really focus on developing this system that supports families. You have the ability as policymakers to expect this and to direct funding to support this. And you have the ability to bring all the partners that child protection needs at the table to truly help serve families: Medicaid, housing, childcare, mental health, substance abuse, to name just a few. And why? because I believe you recognize and see on a daily basis all that is lost and will continue to be lost to these families by this inaction. I'd like to conclude my remarks by sharing the words of a youth from foster care I recently met. This young woman was engaging and talking with a number of folks and was so brave to share her experience with me. She shared, in life, if you are fortunate enough, you will be made aware of your mission through your lived experiences. Thankfully, I have come to find my true purpose of ensuring that the next generation of foster youth does not experience the anguish of a broken system. Throughout my time in foster care, I lived in 53 different placements. Yet, with the help of mentors, I was able to do the unimaginable. And all of this is to say that with persistence, love, nourishment, and policies, we all possess the prowess to beat the odds. I look forward to working with all of you to prevent the unimaginable for the children and families in Minnesota, and I'm happy to answer your questions.
Thank you so much, Ms. Kaplan. So I'd like to open up if we have any questions from members. You have a question?
I would like to thank you for coming, and I have witnessed firsthand some of the very things that you've discussed today, and I would be more than willing to hear more about the programs that are actually in place and the legislation, and to see those bills that have come forward in Washington, D.C., so that we can review those here. I don't believe in reinventing the wheel.
Absolutely.
So if we could have those to look at, that would be wonderful.
Absolutely.
Thank you.
Thank you, Ms. Kalpin, for coming to Minnesota, too. I do appreciate it.
Sure.
What is, can you give further detail about the federal funds and how much that was and the new federal funds?
Sure, and they're coming sort of in two ways. The first being the Family First Prevention Services Act that was passed in 2018 provides an pardon the jargon, but sort of an open-ended funding stream whereby every dollar Minnesota chooses to spend on families who are in need of services to prevent foster care placements. The federal government will match you 50 cents on the dollar for what you spend on services that address substance abuse, mental health, and parenting skills. These services have to meet an evidence-based requirement of being a promising practice. I'm getting a little jargony. So it's not just the ability to spend on anything. It's intended to really invest in what's work. But every dollar you spend will be matched at 50 cents. The federal partnership is around for up to 12 months per family. Obviously, as a state, you can continue to provide services for as long as you would like. And there's no limit on how many times a family could be eligible for this. So recognizing that families struggle at various points in their life, if you wanted to provide services when a family had a child who was 3 and they came back when they were 9, they could qualify for federal reimbursement at both times. So that's an unlimited source of funding. States came forward and talked about the real challenge of moving systems forward and spending dollars in an evidence-based way. So in December, the federal government provided $500 million in one-time funding that's going to be spread among all the states to have 2 years with the stated purpose of moving these systems forward. So these are one-time funds intended to jumpstart infrastructure investment, but really in the spirit of the direction of what Family First was about. Those separate funds will come to you all with no match, nothing. We are working as quickly as we can to encourage HHS to get the funding out. We are still waiting for them to tell us exactly what the state shares will be. And as soon as we can get that information, we'll let you know. But
All right. Go ahead. Senator Rosen.
Thank you, Madam Chair. Ms. Kalpin, so you mentioned October 1st, 2019, there must have been a plan submitted by DHS to be eligible for the Family First, is that correct? And has Minnesota done that? And have all the states, I should say, made their eligibility?
So it is not my understanding that Minnesota has yet submitted their plan. There are states who have submitted plans and have them approved. Arkansas, Utah, Maryland are 3 that are coming to mind. I know the state of Washington has also submitted a plan. So the deadline of October 1 was not really a deadline. It was sort of the first point at which funds would be available. And the other thing I would point out is it's an option. There's no requirement that states have to submit a prevention plan. We absolutely hope and expect that all the states will, but the timing began on October 1, and so essentially there are federal dollars right now that are available to be drawn down.
And so, Senator Rosen and members, for a little bit more information.
Yeah.
In 2019, we here conformed with the federal legislation. We passed the legislation. And so DHS and other key stakeholders from across the state are meeting in work groups to come up to with that planning process of what it needs to look like for Minnesota. And so we do have DHS presenting on Family First after this one here, after this. So Representative Cleveland.
Thank you very much, Madam Chair. One of the things that I've often wondered about is in dealing with substance abuse treatment programs, oftentimes mom gets sent one place, dad gets sent someplace else, and the children get split up. And it's really an awful situation. Have any states that you know of established residential treatment programs where the families can be together so that there isn't any separation, and then they go through their support process together?
Mrs. Cleveland.
Oh, yes, there are. I know, for example, in Kentucky and Ohio, there's a program called START, where they allow the parent and the child to be housed together for treatment. I could be happy to get more information for you and share that, but there are evidence-based programs that are family residential treatment programs that do not provide, that allow for everyone to be together.
So mother and father?
That I would have to look into to see if it was a mother and father, assuming, so let me, if I could follow up with more information, let me.
That would be wonderful.
Absolutely.
Senator Rosen.
Yes, thank you. I just wanted to comment on that. There is actually a mother-child residential treatment program in the Senate district I serve, Welcome Manor. So it is.
Yeah.
Sorry about that. Oftentimes there's mother and child, but I'm just wondering about the cohesive family unit.
We also have a service at Wayside that's in South Minneapolis that focus on families going to treatment together. And often it is mother and their children, but it is. They do have a program.
If I may, very quickly, I will say the fathers in the system will tell us that there are far fewer options for them in terms of services that allow them to remain with their children. And in terms of the availability of a family-type setting, I am less clear on that. So thank you for that clarification. I know that Kentucky START is a mother-child program. So.
Do we have any other questions from members? All right, so I want to thank you, Mrs. Clappin, for coming in from Washington, D.C. The KC Foundation is a national organization who's been working across the country to bring stakeholders together to look at how we can reimagine what the child welfare system needs to look like or could look like in the 21st century. So just want to thank you, your organization, for being a leader in supporting and strengthening families.
Thank you, and please know that we offer ourselves as whatever resource we can to you all and to the state and moving forward in this direction. So thank you very much.
Thank you. Okay, so I spoke a little bit about the 2019 session in which we at the state conformed with the federal legislation around Family First Prevention Services Act. And so it was only it was really important to me because I know if you wasn't in DHS or in those conference committees, you did not know what was happening over in the House. And many of our senators did not have any hearings on it. So it's really important that as a legislative task force on child protection, that I thought would be important that we be informed about what's moving in the state of Minnesota. So please introduce yourself for the record and you can start your presentation.
Madam Chairs, Representative Moran, Senator Rosen, members of the task force, I want to thank you for this opportunity. My name is Ralph McWhorter. I am a staff member of the Minnesota Department of Human Services, I've been there about 30 years, and I've seen changes over time about how Minnesota has responded at various times to issues related to child welfare. What I'm going to focus on specifically today is the Family First Prevention Services Act. We just had a brief
Mr.
description
McWhorter,
of it.
could you speak up just a little bit more?
A little bit louder?
Yes.
Does that help? There we go. Thanks, Chris. So I'm going to spend more time in the weeds about what that Family First Prevention Services Act is, so you have a better sense of the decisions that are coming before our state about child welfare. You know, there are times when we've said it shouldn't matter where you live in Minnesota. We should have a uniform set of services and supports to families. At other times, we've said we need more local decision-making and innovation and flexibility so that different communities can make a decision. And we're back here today again under a framework for a federal law to get back to those kind of decision-making about what you want to accomplish as a state for children and improve outcomes, including the areas related to the disparities that we have in our state. So if you will follow with me through a PowerPoint presentation. That's my style. I hope you can bear with that. And as Christine mentioned just now, Family First Prevention Services Act came into law in February of 2018. And it has two significant parts of a very complex bill. The first part is that it strictly limits federal reimbursements for children who are in congregate care settings. After 2 weeks, we will lose the federal reimbursement unless certain conditions are met. But the thing that Christine also mentioned is the promise of federal reimbursement for a new set of services paid for in reimbursement through the Title IV Act of Social Security. And so that prevention services, we'll get into both parts of that. I just want to say this complex act, it affects many different areas, many different time frames. We got into a little bit of it right with Christine here. Minnesota has provided a non-binding intent to have the act be engaged in by our state and a prevention plan by July 1st of 2021. And in our process, we are talking about whether that's an appropriate deadline or not. As Christine mentioned, there are states who have submitted plans. Right now, there's actually about 7 states that have submitted plans to the federal government that I'm tracking, and the federal government has only recently approved 3 of those plans. About 39 states are like Minnesota in delaying the actual planning of the implementation of the act until the last year before the ultimate deadline of October 1st of 2021 hits, when those federal reimbursements for congregate care get applied to us. We'll go into a little more detail. So as I mentioned, in the congregate care world, we'll only get federal Title IV reimbursement, which is 50% of that congregate care stay for a child in those settings, unless the new settings meet new federal requirements for a whole new category called Qualified Residential Treatment Programs, or for programs that specialize in providing prenatal care, postpartum, or parenting supports for youth, or settings that provide independent services for youth who are 18 or older, or they provide a high-quality residential care and support services for sex-trafficked youth or youth at risk of being sex-trafficked, or, and part of the conversation you just had, settings where the parent is located in a service to treat their substance abuse and a child is co-located with them. Then we will be able to get a federal Title IV match to cover the maintenance costs of that child in that setting. I'm tracking there's about 5 settings in our state that actually currently provide that level of service, and there's some question about whether that's sufficient capacity or not. Getting into the weeds about the Qualified Residential Treatment Programs, the QRTPs, Again, the third week, we stop getting federal reimbursement unless those types of settings come up to new higher standards that were created in the new federal law. And those standards include requiring the facility to provide trauma-informed care, that they have licensed nursing staff available based on the needs of the child, that they facilitate involvement of the family members in that care, that they document how families are integrated into the treatment and post-discharge planning of that process, including involving their siblings of that child, that there is discharge planning up to 6 months of aftercare in the service provision of that setting, and that they be licensed by the state and accredited by some of the national organizations that accredit facilities. In addition, the federal law and what Congress said is that we have to make sure children should be in those settings. And so assessments must occur about the appropriateness of the placement of those children in those QRTP settings within 30 days of placement. The challenge is to keep high criteria in place to determine who's appropriately placed in there and how long they should be there, and if they're in there a long time, are appropriate approvals in place to make sure that it's necessary. There we go. There's an example of a flow chart of the federal requirements. I'm not going to go into all the details, but just so you know, Congress decided that there are specific deadlines that have to be met for the review of the placement of the child and what's necessary to determine they need to be in there. That'll be in your packet for further review. What do we know about Minnesota and meeting this portion of the Family First Act related to congregate care? Well, we had the assistance of Minnesota Management Budget to do a survey with us about residential settings. And what we found out is about half of those settings that serve children in congregate care now think that they meet those federal standards. Most of the difficulties lie in being accredited by a national body, being able to provide the 6-month discharge planning, providing the assessments by an independent person, and having available registered nurses to provide those nursing supports. Most of them were willing to come into compliance with some financial support. Things like accreditation costs more than $10,000, $20,000 on an annual or every 3-year basis. So there are costs incurred, as well as things like the 6-month discharge follow-ups. If you look at this map on the page here, you'll see kind of where kids are in those settings. And when we looked at some of the financial analysis of this, we see that Minnesota is at risk of losing about $6 million to help support the 2,800 kids who have experienced care in 2018. So it just gives you a picture of this. And then you may be tracking that in Minnesota, the county local resources provide over half of the revenue to support the child welfare system. And the federal and state funds make up basically the remaining shares. So this is a significant area. More money is spent in foster care on family foster care, but we do spend money on congregate care, and we're at risk of losing about $6 million if we don't come into compliance by the October 1st, 2021 deadline regarding this area. So I'm going to make a transition, but I'm going to have you, bear with me if you could look at this chart on the screen for a second. On the far right side is everything we know about the current system as far as Title IV-E under the Social Security Act. What we know is that the federal government already pays a 50% reimbursement for out-of-home care, permanency, and some reunification. And Title IV-E pays about $100 million of the $200 we spend on things like congregate care, family foster care, adoption, and kinship guardianship. But the other part of the act that Christine mentioned is this focus on prevention services. And so I'm going to spend another portion of time here talking about that. And so on that left side of the graphic, you can see where we're starting to say the states get to determine who's eligible for a prevention services, what those services are, and how the funding match will work with that. As I mentioned, the Act creates a new optional reimbursement for funding for prevention of out-of-home placement, a 50% match for children who are candidates for being in foster care, children in foster care who are pregnant or parenting, or parents or kin of caregivers of those children. And this is where it's different than Title IV-E. In this part of the program, it doesn't depend on the income eligibility of the child or the family. It does in Title IV-E traditional programs. So if you're following me, this is an interesting part of the Act, which says we can serve a broader pool of people who don't have some of the income inequalities. It can be a broader pool of people. And the candidates for foster care is specifically a person who would benefit from prevention services that are supported by the federal government's evidence-based clearinghouse to help prevent entry into foster care. As Christine mentioned, here's some of the categories that the federal government and Congress agreed would be available under the prevention services side of the Act: mental health treatment, substance abuse treatment, and prevention of services, in-home parent skill-based programs, and kinship navigator programs. And the little kicker here that's kind of been irking the states is that it requires a high level of evidence-based practices, and a federal clearinghouse has been created to determine which programs would be eligible under this new federal state option. So what we know is that 50% of the programs that would be provided under this prevention services would have to meet the well-supported practice criteria as determined by the federal clearinghouse. Here's some examples of what the federal clearinghouse has already approved, and I'll just throw up these specific services across different domains of mental health, substance abuse, parenting skills, and kinship navigator. These are the ones the federal government has said, as of today, Minnesota could put into a plan and get reimbursement for. I'm going to follow up on this next page with these are the programs on the following here that are being currently reviewed. This is what's happening right now by the Federal Clearinghouse, and we're waiting for their approval of these programs. So how is Minnesota doing this area of prevention? What we know is that through a survey with Minnesota Management and Budget, that the services in Minnesota providers in prevention area find it difficult to hire and retrain qualified staff. It's difficult to pay for training and certifications. And some of the services are logistically challenging because they require families to come into a service center site for the service, and not all families can do that. This map shows you what we know right now and what we have online on the Minnesota Management and Budget page about where those prevention services are. And I'll just mention for those of you who are keenly interested, there is a drop-down menus to find out if you're interested in substance abuse programs, where they're at in Minnesota. If you're interested in the mental health services in Minnesota, you can do a drop-down as well. So I urge people, if they're interested, trying to find out what's nearby your counties, whether you're in the far northwest part of the state, you're in the metropolitan area, or you're down on the southern border, what's happening as far as provision of prevention services that might be eligible under the Family First Prevention Services planning process. What Minnesota has to do is submit a federal 5-year plan to identify those services that we're going to provide, determine the eligibility for candidacy for those people who would be eligible to receive those services, and evaluate the effectiveness of the provision of those services. We also have to monitor the safety of those children in that process. So these are all additional process efforts that we have to make, and we have to describe that to the federal government. What we know from the experience of the 3 states have gotten approved plans, the federal government has negotiated with them to modify their plans to meet some of these requirements to the level that the federal government is looking for. One of the decision points for Minnesota is to determine who's going to be eligible for these prevention services. Are we going to use a narrow definition of who's eligible? Those who have come to the door of the attention of the county or a tribe involved in American Indian Child Welfare Initiative to say that a person is at risk of maltreatment or neglect? Or are we going to use a broader set of criteria to make a decision about who might be eligible for supports? So this is just an example of the range of criteria that Minnesota could develop in its state plan. put up another graphic that's just one of those complex flow charts that kind of says, this is kind of what the options are in Minnesota right now, and in the very dark boxes is kind of the main pipeline for people who are determined to be maltreated of abuse and neglect, and how that flow works. But Minnesota has some options about whether we want to identify other people in that flow chart or additional people even on the broader front end who come to the attention of people with known characteristics that might lead them into being neglected or abused. And so Minnesota has to make that choice. I'm going to quickly, I know I'm losing some attention from people, so I'm just going to say there are a few other things going on here in the Family First Act related to adoption assistance, Title 4B, and the Chafee foster care program. I'll just skip through that. So I want to talk about what we're doing right now. Basically, we've completed the development work, we've done the surveys, we've looked at the data queries on the financial modeling of what we might lose and risk on the congregate side. We've been investigating the prevention services side. As Representative Moran indicated last session, we had a bill and a governor's budget page that provided some initial supports to put us in line with the federal requirements. We've received approval from the legislature about that, and we've issued instructions to the counties about how to proceed in certain parts of the act. We're also working on outreach and coordination with our partners, and we've been hosting public meetings with our stakeholders and community representatives. We've had active governance discussions in those stakeholder meetings, and we've created an advisory committee, coordinating committee, and work groups. And we've been developing some draft legislative and budget proposals that we hope will come through the governor's office and will meet with your expectations going forward. So what do we have to do? We have to figure out what's going to be on that state plan. We have to finalize how we're going to actually get the federal claiming, and we need some help from the federal government on some instructions about that. And we have to make the computer changes actually to be able to receive the reimbursements. We have to have a worker be able to identify something, an appropriate person, an appropriate service, an appropriate claim, so we can actually get the federal money to flow. So the next few pages just give you an example of the work groups and the activities of the work groups and the goals that we're trying to have for that. And I'm going to keep moving on here. So Christine also mentioned this new federal funding source that just came through, and Senator Rosen asked this question. So just this back in December, as part of the larger stopgap budget bill in Congress, Congress approved $500 million for assisting states one time temporarily to make the transition to develop and implement Family First. What we anticipate is that Minnesota might receive about $7.8 million if they follow the Title 4B1 formula that was prescribed in the law. As Christine mentioned, there's no state match, and we are trying to look through and think through what the options are for the funds. We have not received the funds. The federal government has not issued them, and it has not issued the strings and the requirements around those funds. We anticipate, though, that we might have something like a Legislative Advisory Commission request as soon as we find out, and that might be the 20-day request or 10-day emergency request. So as soon as we know that the monies are available, we can seek support and try to move forward to be able to bring those dollars down. There's a little other piece of this, that new federal Family First Transition Act allows us to delay the requirement for having well-supported practices meet 50% of the eligibility for reimbursement. And in the big scheme of things, that's minor, but it's really going to help states try to bring up to speed a lot of prevention services in the next 18 months or so. I'm going to throw in this, I'm the nerd, so I've thrown in all the federal instructions, and if you want to follow anything related to what the feds are telling us, I've starred the items that if you don't read anything else, read the starred items, and that give you a little more information about what they're telling us. And I've put in a time frame about where we're at in the process and the deadlines that are necessary. And well, my name is Ralph McWhorter. If you have any questions, you're welcome to contact Jennifer Summerfield, our legislative liaison for the Children and Family Services Administration. And so with that, I will conclude my presentation.
Representative Cleavon.
Thank you, Madam Chair and members. And to the testifier, I have two questions. One, on page 11, and you don't need to flip back to page 11, but when it talks about candidates for these services, so I guess it really is on page 12, I'm concerned about parentified children because it talks about for parents, but children also become parents to their siblings. I'm wondering if there's a place that we can get that qualification added so that they would qualify even though they're not the biological parent.
Mr. McCorder.
Madam Chair, Representative Cleburne, if I think I understand your question is, can siblings who take parental responsibilities, can they receive supports over?
Right.
I'm not sure I have a direct answer. I think Minnesota could try to put that in the plan and see how the federal government responds to it. If that's what we would like to do, I think we can put that in there, and we may have to have a negotiation with the federal government. But it seems like an appropriate intent of the law that we provide prevention services to the child, the family, and the kin. And I would think under those definitions, we might consider the siblings also needing that support.
Okay, so that was one. And then also on the slide where it talked about broadening the, narrow or broad definition of candidate for foster care, it causes me a little concern when I see things like families in community areas with high confluence. I just want to make sure that we're not targeting neighborhoods and making sure that all families are equally reviewed. So anyway, I'll just leave it at that. And I would like to apologize to all of the individuals who've come today. This is a very important conversation, and unfortunately, I have two really important conversations going on at the exact same time. So I will be leaving in just a few minutes to go to the other meeting, which I have now missed an hour and a half of. So please forgive me. It's not that I don't think this conversation is important. It is critically important, but I also have another critically important conversation to hear as well. Thank you.
Mr. McCorder, you want to respond? Or do you want to?
Madam Chair, I think Minnesota has to make that decision about how to define who will be candidates. I don't think the intent is to do targeting in the frame that you're putting it. The federal law actually would allow states to target and to target even regions of a state. We don't have to implement it statewide. As Christine mentioned, the prevention services is an option for the states, and we get to make the decision if we want to go that route, and we can decide whether we want to do it geographically, by different populations. I think most people are just saying, how do we identify who's in need? And what are the characteristics of people who are in need, so that we could say that's the group that we're going to have prevention services being made available to.
And Mr. McCorder, one of my concerns is that there's no income level. And so, that impacts the amount of money we have, that impacts who have services, and so I'm just hoping that we are conscious of that. Because, one of the things that we do have is like these huge disparities. And we want to make sure that we are focused on creating better outcomes in those areas too.
Madam Chair, if I may respond, that's one part of this thing that we have to be thoughtful about, is that if we go down this route with broad definitions, someone has to pay the non-federal share. We'll get a match, but we have to pay 100% of the bill and get reimbursement for 50%. So what's Minnesota going to do to generate that non-federal share? Are there resources now that we're not serving as match to other federal programs? Or are there other avenues that we can think of to provide that greater level? So the broader the definition, the more people may be receiving the service and the more non-federal match we're going to have to generate. Now, Minnesota could make some decisions about tiering and staging the process also. So we could start narrow and over time build it to a broader level of service support for a broader array of people.
Thank you. Thank you. Any questions from members? Good. Okay. All right, so thank you so much for updating us on where we are with the Family First Preservation Services Act and for some, just giving some updated information about the conformity that we made in 2019.
Thank you.
Thank you. So next on the, and so another part of what we did this past legislative session is that because of the really high number of foster parents and child protection workers and social workers who was leaving the field, new social workers coming into the field who were not always highly trained, we looked at how we can create a process to have, to create a Minnesota Child Welfare Training Academy. And so we passed that this last session, and I would like to hear where we are with that implementation of the Minnesota Child Welfare Training Academy. So can we get Dr. Tracy Liberty to come forward? La Liberty. Okay, so we also have a new member that would like to give us the opportunity to introduce yourself.
Thank you, Madam Chair. Madam Chair, two Madam Chairs. I'm John Hoffman. I live in Champlin, and I'm sorry I was late this morning. I would blame Highway 10, which we can, because, you know, there are 98,000 cars per day along that stretch, and 35W got all the new construction, and there's only 60,000 along that same stretch. So
Well, welcome. We're glad you're here.
I'm trying to be funny, but yeah, I'm reminded. You looked at me like, no, John, you're not funny. So it's good to be here, and thank you for hosting this, and thank you for talking about Title 4E and how we can go about looking at how you blend and braid some services and programs like other states have done, Indiana, Massachusetts. So I'm absolutely looking forward to working on this thing. So thank you for letting me be here.
Thank you. To the testifiers, please introduce yourself.
My name is Dr. Tracy Laliberty, and I'm the Executive Director at the Center for Advanced Studies in Child Welfare, which is a research and training center in the School of Social Work at the University of Minnesota.
Good morning. My name is Tracy Crudo. I am the Manager of Workforce Development and Training at the Department of Human Services.
Okay. Dr., whoever would like to start, please proceed.
Did you need me to do the PowerPoints, or you were going to do them, Chris? That'd be great.
Please proceed.
Madam Chair, thank you. So we're going to present a pretty concise update to the committee in terms of what's been happening for the development of the new statewide Child Welfare Training Academy. And mindful of the full agenda, we're going to move pretty quickly. And so if people have questions, please just interject those or ask us at the end. When the slides are up, folks will be able to see legislation was passed in 2019, and the structure that's listed on the slide really includes 4 elements. System structure, training enhancements, and evaluation and accountability. So the Training Academy, as it was talked about and passed in the legislation in May, was to establish a state-university partnership, and that research has shown us, and models across the country have shown us, that that really is the best model for being able to deliver the highest quality training. That training in a systematic way needs to be interdisciplinary, and that we need a regional training model. The training will be delivered through multiple modalities. The audience that was approved in this funding were for frontline workers, supervisors, and some private agency professionals who are delivering child welfare services on behalf of counties and tribes. We'll be offering both foundational and advanced level curriculum, and that the focus on disparities, disproportionality, and implicit bias runs throughout all aspects of the training. Other enhancements that are added into this training academy include simulations, professional coaching, some race equity coaching, and mentoring. And then finally, the evaluation and accountability, being able to be accountable not only to the kids and families that we serve, back to the legislature, being good stewards of the dollar, and to each other as professionals who are working to advance these things that we're working on, include the use of our statewide adopted child welfare competency model, which has been established for a number of years now. The supervisor competencies, we will be establishing a credentialing process that all workers and supervisors will need to participate in, and will improve the overall training evaluation. This slide is really just to remind folks that there was a fairly in-depth study that was done, and that report was brought to the legislative task force a number of years ago and was really the precipitant to what was framed in the legislation. This was based on listening sessions that occurred in a diverse group of communities all across the state, including sessions with counties, tribal partners, tribal communities, and communities at large. We did a number of site visits across the country and really did a research examination of training models. So we look at the implementation of the Training Academy in phases. We're in phase 1 right now, which is the first year. One of the big lifts at the very beginning, of course, anytime you have a state university partnership, is the development of the joint powers agreement, the contracts, and being able to sort those details. That went surprisingly quickly and was a pretty smooth process for us. So we were able to actually start on the university side in September. The centralized training facility is another large or significant aspect of phase 1. And I think a logical question, something people ask me often, is why are we starting with a building? Don't we have more pressing matters? And all of our matters are pressing, to be honest with you, but one reason is really without dedicated space, training was unable to be delivered in a timely fashion. We talked about for years all of the delays in training. Staff and administrative time was spent searching for space, coordinating being displaced, managing supplies, transportation, all those types of things. The new facility really alleviates these burdens and allows the staff to focus on the task at hand, which is training in a comprehensive, robust, and diverse manner. We've gone through the first round of staff hires. There were only a couple in this first year. There's much more to be done. We've established a communication strategy, and we've started to expand new worker foundations training. And really what that means is being able to update the current training curriculum to address new policy changes, but also to look at gaps that had been brought to our attention, gaps that we knew existed, and to fill that in. During the time of reform, when there were so many workers coming through training, we had to condense and reduce. So we needed to go fill back out to what we knew was appropriate training. And this is, I find myself wanting to say a stopgap measure. It really is. It's an interim plan, because a full, robust review and overhaul of the training curriculum is yet to take place, but we needed to get some immediate things done. We've also established a new partnership in consultation with ICWA Council, with the Center for Regional and Tribal Child Welfare, which is a center similar to ours in Duluth, and we've added 2 additional days to new worker training specific to ICWA training and working with Indigenous kids and families, and that has started, the first one occurred in January. We're preparing RFPs for the 4 regional learning centers, or as we described them in the last session, hubs, so that it truly is a statewide model, and that there will be opportunities for training to take place in greater Minnesota. And then finally, we are embarking on listening sessions, and I'm going to turn it over to Tracy.
So in March and April, we'll be hosting, we've got 9 listening sessions planned in locations throughout the state with more in the works. Those listening sessions will consist of both day and evening options for sessions so that community members have easy access to be able to attend. These listening sessions are important as they're going to focus on the tasks immediately ahead of us in implementation, particularly some of those first stages that Tracy was describing, and we will be describing in a future slide those tasks that are ahead of us immediately. Training priorities is going to be a big piece of what we're hoping to gather feedback and input from the broader community on, particularly focused on new worker and new supervisor training, what the community would desire to see for that. So in this slide, you can see we had, back in 2015, when the work group was established for the implementation of the task force recommendations that were specific to workforce development. The community group came up with 2 proposed models for enhancing new worker and new supervisor training. So you can see in new worker training, currently we have, with the expansion that Dr. Laliberty was discussing, we have 14 days of training over about approximately a 3-month period. What is being proposed, or what was being proposed in 2015 by that work group, was that we really look at training scale up over an 18-month period. We front-end load some of those essential skills and knowledge around the child welfare practice continuum, critical strategies and skills in the front end, but we look at continuing to develop the worker over time as they're taking on more cases and working with more families. This allows for some customization, not a one-size-fits-all, but really looking at what each of the workers need in terms of their career paths. You know, some workers are very generalist in greater Minnesota. Some of our workers in the metro very specifically focus on one part of the continuum. So we wanted to build a system that would work for all workers. Similar with the new supervisory training, one of, I think, the core concepts that the group in 2015 wanted us to build the supervisory training around was this idea of coaching skills, to be able to not only enact those with their workers, but to model them for workers to be using a coaching approach with families. So in the implementation in phase 2, as we move into July, as Dr. Laliberty talked about, we are putting out the RFP for the regional learning centers. We anticipate those being partnerships with existing community agencies, so community-based agencies, public and tribal child welfare agencies that we hope to partner to embed these learning centers in already existing agencies to work more closely and be right hands-on in the field with workers. We're working to establish a regional and statewide advisory councils around training to embed and in our infrastructure a constant community feedback loop. In phase 2, as we head into year 2 of the implementation, really that's where the majority of the staffing resources will come online, including 4 positions that we have dedicated to what we're calling equity coaches or trainers. And those positions will be focused on reviewing, researching, and implementing training and coaching strategies specifically to address disparities and disproportionality. They'll be doing that through focusing on addressing implicit bias and improving intercultural communication and work skill. As Dr. Laliberty also mentioned, we'll be entering a more comprehensive revision of our new worker, new supervisor training. That's why we're going out into communities ahead of that work to make sure that we are getting all of the community input into what we would like to see in that training. Got some more kind of mundane things about creating a new learner management system, evaluation practices and tools. Those are important as they increase efficiency and ease of use for the workforce. So those will be important parts of the next phase. And then, as we mentioned with the statewide advisory boards, continuing both formal and informal ways that we're engaging stakeholders in all aspects of implementation. So that is our plan. That's where we're at and where we're heading. If anybody has any questions at this point, we'd be happy to answer.
Senator Hoffman.
Thank you, Madam Chair. So Help me understand. I'd love to see how this gets launched out. There's, since 1975 at the Pattee Hall, Michael McConnell was part of, I think Ann Bailey is now the director of the SEED initiative that accesses those positive outcomes. You're shaking your head. Are you working? That was a federally funded program, and I know the Department of Human Services also funds for doing that, because when we're talking about equity, are we also including children and youth with special health care needs or those with disabilities as assigned for the years? Can you help me understand that a little bit more?
Yes, please proceed.
Thank you. Yes,
Dr.
Senator.
Liberti.
Actually, our center, the Center for Advanced Studies in Child Welfare, have a very close partnership with SEED and the professionals over at SEED. We do quite a bit of work with them, and we will be bringing them in, as well as a number of other interdisciplinary partners, into helping us shape what the curriculum is moving forward. And certainly kids with special health care needs, disabilities, frankly, parents who have disabilities, is an area that is often neglected across the country, and certainly has been here in Minnesota. And all of those things will be addressed moving forward.
So, Madam Chair, just as a follow-up, also in that building, Amy Hewitt, there's the AUCD, which is also a federally funded program as well. They've established for years the network that's available, and so even though you're not mentioning it in any of your slides, I think it makes sense when we're looking at the public dollars and the public good that we're accessing all those. So it's good to hear. I'd like to hear more about how you plan to implement that relationship. Because they're nationally known and their outcomes are absolutely good. And those are both the Institutes for Community Integration, which is Hewitt, and then it's Bailey now. I want to say McConnell, but he's like retired, right? That dates me how old I am, so thank you.
I'm going to ask two questions, then we'll hand it over to Senator Rosen. So I was looking at the new workers training, and you have the essentials, it's like the overview of the child welfare continuum, and basic skills and knowledge, and that needs to be done right away. So what we also found when we had so many social workers who were retiring, new social workers coming in, ready to do the work with their bright, ideas, is that biases shows up, right? Biases shows up, and so I would think that would be like an essential part of what we need to do with workers immediately. The whole cultural competency training that is embedded, that needs to be embedded throughout. Implicit biases, what do that look like? I will hope that would be a big part of any new trainer's experience when they're going to be interacting with diverse communities, especially within the African American community. Mrs. Crudo?
Madam Chair, members, yes, that's absolutely what we would consider an essential skill. And as a matter of fact, right now, the first 3 days of training before we even get into talking about the child protection continuum, we're really focused on implicit bias, really having workers do their own examination of what they're bringing to the role, understanding the power that is implicit in the position of child protection and how they can impact families for generations, and that it's absolutely imperative that they're doing their own work and examining how they're coming to the work and partnering with families. So that's the lens we want them to strongly be looking through as we move into teaching them all aspects of the child protection continuum. And yes, our intention is to improve that and make it even more robust as we go through our full revision.
And my second question is, are you doing an RFP for trainers to that is like reflection of those communities to do the training around implicit bias and cultural competency? What do that RFP look like, or you already have something internally in place? Dr. Liberti.
Thank you, Madam Chair. So currently, there are staff trainers, and then we have community trainers. The community trainers are actually considered temporary casual employees of the university, and we have an ongoing call for trainers to apply, that we bring in and do some tailored conversation trying to recruit and target some recruitment in specific communities to train specific curriculum, but also to be more representative. Very important for our learners that trainers have child welfare experience in addition to other types of life experience that they bring in. So that's an ongoing process that started at the university, that moved from DHS employment contract over to the university this spring. And so it's an ongoing thing that we're working on.
I know within DHS you have your internal training pool that you usually pick from, and I don't know what that looks like now because it's been a while for me, but I'm hoping that within that it is a diverse pool of those detailed knowledge base that they would need to have that you can choose from.
Yes, Madam Chair, that was what I was talking about. That internal pool has shifted and is not at DHS anymore. Now it's at the university. And as that shifted, we created a new recruitment opportunity and have been tailoring the search exactly as you've said.
All right, thank you. Senator Rosen?
Thank you, Chair Moran. My question was very similar to the direction that you were going, Madam Chair. But I guess a little bit further, the statewide listening sessions, do you anticipate some essential skills difference between each of the regions? And is there a formal, are you going to be coming back to the legislature to tell us about your results and how we need to perhaps adjust going forward?
Dr. Lollyberry or Ms. Kudo? Ms. Kudo.
Yes, Madam Chair. We do anticipate that there will be regional differences in what folks perceive to be the primary issues driving services in their particular areas. We know that there are some strong skills and knowledge development that will be consistent across the state, that we will want to be consistent throughout the state. So the opportunity to have regional presence is a great opportunity for us to be able to provide some customization while assuring some overall consistency in the quality and the types of training that are provided. And yes, it's our intention to develop a report based on the listening sessions, and as a matter of fact, to have an annual report on the offerings and the activities of the Training Academy.
Okay, Senator Hoffman.
Thank you, Madam Chair, Chair. The other thing that I want you to explore, help me understand, is there was, since 1986, there was a federal law that went into place specifically gearing toward collaboration, comprehensive, and coordination of services targeted to birth to 3, right? Minnesota is a birth mandate state. That means services and supports birth through 22 fall into a category that receive special education or related services. Now, set that aside. There's 2 populations in there. There's Part B 619, which is the 3, 4, and 5-year-old. And within there's those community integration aspects to it. But I want you to focus on the birth to 3 piece. There's already a network established within the state. Are you tapping into what the federal government has said we should be doing since 1986? And how is that being utilized to help support your initiatives here? Because those desirable outcomes seem to be the same as your desirable outcomes. Is that correct?
Dr. Lollyberry?
Thank you, Madam Chair. Yes, I would say that all of the things that all of the partners that you've talked about and the areas of birth to 3, the early childhood, all of those elements will be taken into consideration when we're doing the revision, and that we will be leveraging the federal knowledge, the local expertise, the national expertise, as well as our community expertise to be able to inform exactly what we're going to do. I think, so that the committee understands and the community understands, one of the big challenges that we have here is, and we anticipate this in listening sessions, we're going to have such an incredible volume of topics and knowledge and skills that people feel are essential that people could literally never be in the office right? So we have to balance in partnership with the counties and the tribes how much capacity they have for workers to be out of the office and in training over what period of time, and how can we improve on what we've already done. Instill as much of the content as we can across the lifespan, certainly the birth to 3, the disability, the special education, special needs. It's vast. And so we are going to be going through a process and really be relying on a lot of different resources to be able to help us get to the place that we really need to be to offer the most robust, comprehensive, and manageable training system that we possibly can.
So as a follow-up, Madam Chair, I'm glad you mentioned the tribes. Within that law since 1986, there are 4 of the 11 tribes that get early childhood dollars. And actually, if you look what Red Lake did with that, that comes through the Department of Education federally to the Bureau of Indian Affairs and then goes to that. And as far as I know, it's still just 4 of the 11. But like Red Lake has this beautiful early childhood center, there's already some work that has been done, so you almost don't have to recreate the wheel, but rather, if you truly look at the Franz model of that interagency collaboration stuff, it's there. It's just a matter of setting down those, getting rid of the barriers that exist and tap into those. I mean, this is something that my old professional life had been working on for years, and it's exciting to see this get recharged. And I just would say to you, please make sure you don't forget about those pieces within the early intervention law that's there. And I'm glad you mentioned the tribes. Again, I'm just going to be a broken record. 4 of the 11 do some pretty integrated stuff with the early childhood stuff. And part of that, too, is they tie into some Title V public health dollars as well. Sorry I'm getting wonky, but this is a policy conversation, and I happen to love that stuff. So thank you for your work.
And I did make a prevention and intervention a priority in the work that we do moving forward. Is there any other questions? Okay, so why don't we move on to the proposals from DHS around to address the inequities from the African American Children Family Act in the Minnesota Child Welfare System. This is piece, as we can see, I think I've said a few times that African American children has been disproportionately removed from their families. I introduced the African American Family Preservation Act in the House, Senator Hayden in the Senate. It moved through the body in the House, and which is why I'm so glad that my senators are here today to learn a little bit more around this issue and how we can move forward, to ensure that kids are connected to their family and their community, and the harm that happens when they're not. So DHS, the bill in its entirety did not pass. So much like the Native American community, our children are being removed. And so, other than the pieces within the bill that I believe became law, there are still some work that we need to do. And so DHS staff have looked at those initiatives, because sometimes when we can't move things statewide in this body, there are other things that we can do with standalone bills, and also in partnership with counties and other ways we can do that work. So we have, yes, and so DHS will present, but before you begin, let's let Senator Rosen have a word.
Well, thank you, Chair Moran. And unfortunately, these 2 senators have pressures in their district that we have to go take care of, and we are outstate senators. So my apologies for that. I am becoming very familiar with this bill and have some more work to do. And my pledge to you and to the folks in this room is that I will become very familiar with the bill and see what I can do. We are having another child protection hearing soon. Haven't got it on the date yet, but on the books yet, but we will be taking another swipe at this. So, and my advice is to look at the pressure points in the bill, why we have such a large fiscal note. It's extremely expensive, that is a game changer, the fiscal note on the bill.
And I think we can work on that.
I
And I
agree.
look forward to this partnership.
Great, thank you.
Thank you.
Do you know what committee was that original one referred to in the Senate? Does anybody know off the top of?
Senator Ablers.
So it's in reform, so it starts in reform, the jurisdiction. Okay, thank you.
Policy and Finance in the Senate. So it's stuck in that judiciary. You can have to work on that. But I look forward. Okay. Thank you. So please introduce yourself for the record and proceed.
Thank you, Madam Chairs, members of the task force, for this opportunity to come before you today. My name is Lisa Bailey, and I'm the Acting Assistant Commissioner for Children and Family Services at DHS. Compared to white children, African American children are 2.3 times more likely to be involved in a report of maltreatment, 3 times more likely to be involved in a maltreatment investigation, and 3 times more likely to experience out-of-home care. These numbers are unacceptable and must be addressed. While my presentation today will deal specifically with some ideas on how to address this overrepresentation of African American children, it's also important to note that American Indian children are 18 times more likely to experience out-of-home care than white children. As was just discussed, the African American Family Preservation Act was introduced last year, intended to address the issue of African American overrepresentation in the child welfare system and the damage that that overrepresentation has on the parents and children involved in their cases and the African American community as a whole. Since last session, DHS staff have spent many hours reviewing the act and considering the goals and themes of it. From there, staff has developed an array of potential proposals to address the service and program gaps that contribute to the disproportionate involvement and disparate outcomes experienced by African American children and families, and to positively impact those trends. In developing those ideas, staff tried to ensure that they align with the African American Family Preservation Act and support the primary goal, preservation of the African American family. These ideas for potential proposals are not intended to compete with or replace the African American Family Preservation Act. They're meant to be complementary and to be considered alongside it. Some of these ideas will require funding, some are policy only. As DHS continues to gather feedback and refine our work and talking with stakeholders and community members, people with lived experience, we may bring back some of these ideas to the legislature in 2020 or in future ideas. The thoughts of the task force are important to have as we continue to consider how we can help address the unacceptable problem of overrepresentation of African American children and families in the child protection system and the disparate outcomes that those children and families face as a result. I'm just going to give a fairly high-level overview of some of these ideas. Again, these are works in progress and things that we want to continue receiving input on. The first two are policy-only ideas. And these are, first of all, for strengthening the legal requirements for removal of a child from the home. This would require, by statute, a description of actual agency efforts, including an agency's assessment of a child's safety and alternative family or kin-based arrangements in order for a court to, the court order would need to include all of those aspects in order for a child to be removed. The second policy proposal would strengthen relative search, relative engagement, and consideration process. And so what that would do is require there would be strengthened requirements for local agency staff, social workers, as well as court oversight of local agency efforts in this area. In other words, to find alternative placement options that are family or kin, possibly friends or kinship members who might be able to take those children, rather than placing them into stranger care or group care. The remaining items do have some kind of a financial impact. The one that we're looking at first and foremost would be funding for community-based agencies and those would be in Hennepin, Ramsey, and St. Louis counties, to contract with community-based agencies who primarily serve African American children and families to provide community-specified services for family preservation, family relative engagement, and reunification services. And reunification is the term of art we use when we want to return the child back home to the family. A second proposal would be a mental health consultation pilot for school personnel. And this would establish a real-time consultation method for school-based mental health for personnel, particularly teachers, who could, on a real-time basis, contact someone either at the school or at the county level or outside in the community to ensure that reports of child maltreatment are made based on statutory requirements rather than potential misunderstandings of a child's mental health and behavioral needs. So this would be to ensure that referrals to the child welfare system are made for valid reasons. DHS, on another proposal, would work with counties and stakeholders to plan for the development and evaluation of high-quality models of parent legal representation in Hennepin, Ramsey, and St. Louis counties. I'm a former CHIPS parents attorney myself. I know that the system is underfunded and it's not uniform across the state, and that's something that we very much want to look at. We would also propose to expand a Healthy Transitions to Adulthood program, and so this would expand the number of grantees from current 11 areas in Minnesota where there's a service gap, particularly for African American communities, and would require culturally responsive programs to be made available. And this would aim to help youth who are ages 14 up to age 23 transition from foster care to adulthood while avoiding homelessness. We would also seek to expand the Homeless Youth Pilot Program, which would fund a continuation of an existing pilot program enacted in 2017 to provide funds in Hennepin County to develop a response system capable of meeting the needs of minor youth who are homeless and without the support of a parent or legal guardian, and expanding it to another county that serves a significant African American population. We're also looking at a case review system for racial overrepresentation. This would be funding for department staff to build a case review system that focuses on reducing racial and ethnic overrepresentation across the child welfare system, and to design and implement a rapid consultation model, so that would be a real-time, someone who you could actually call who is dedicated to answering those phone calls and answering those questions for cases involving families who are alleging inequitable treatment in the child welfare system. We're also looking at an internship program for students with expertise and connections to the African American community. And this would be for funding for planning for the development of a pilot internship support program for students pursuing a social work or related undergraduate degree who have prior experience working with African American children and families or a connection to the African American community. And basically that's to promote future employment at public sort of county, tribal, or state entities and private child welfare agencies where a certain percentage of the target population comes from a community that's overrepresented. We know, as Representative Moran discussed earlier, that the worker supply system, we need that to be as absolutely diverse as possible, and that's something we're working to support. We're also looking at a child welfare disproportionality work group. That would establish a work group to study and make recommendations to the commissioner on best practices for serving African American children and other children whose racial and ethnic groups are overrepresented. And finally, and this is one that may come before this body this year yet, through another route, which is aligning background study requirements. Right now, there are different background study requirements for foster care providers, family foster care providers, than there are for adoption. And we would be looking to align those. And so we've been providing some technical assistance this year on that, but that's certainly something that we're very interested in. So that's a fairly high overview of a lot of different ideas. We've received quite a bit of input, critique, some thoughts on this. It's something that we are willing to collaborate and partner with others on, and if there are ways that pieces of this can move forward this year or next year or whenever, it's something we are very concerned about and want to make sure that this body knows about it. And with that, I'd be happy to answer questions as best I can, and I have some colleagues here who could help me as well.
Members, we have any questions? Senator Hoffman.
Thank you, Madam Chair. Thank you. How are you? Since 2014, we had started putting money into school-based mental health projects that were flexible. Is there a barrier to why we're not able to access that system, or are you accessing that system? And if that's the case, what would be needed to enhance that system?
Ms. Bailey?
Thank you, Madam Chair, Senator. I'm not sure I exactly understand the question. Are you asking about if those funds would be available for this type of program?
Madam Chair, just we already have there's already an infrastructure in place that was started in 2014 when we first put $10 million into school-based mental health. It was utilizing third-party entities to be able to go in and help support the schools. And I know in the largest school district in the state that was allowing them to put just one school-based mental health counselor throughout their 47 buildings, but it's still, that system is in Minnesota Department of Education, right? That's where the money kind of flowed through there, but and I stand to be corrected if that's the case. But it allowed the school districts to be able to access those folks not necessarily part of that system in order to enhance the school-based mental health services. Jennifer's coming up. She can give the update. Thank you.
I'll defer to my colleague, Jennifer Sommerfeld.
Welcome to the hearing. Please introduce yourself.
Thank you, Madam Chair. Jennifer Sommerfeld, Legislative Director for Children and Family Services. I am up here to answer the question, but I don't have a complete answer for you. We are working with folks in our behavioral health department, I know, on how this would be implemented and rolled out, and speaking to school districts on how to accomplish this. So it's related, I think, but I don't know enough about the exact program you're speaking of to be able to say for sure, but we can look into that if that's okay.
So, Representative Senator Hoffman. Senator Hoffman.
Some would say that's a promotion, right? But
it really would be. So, we work in silos. So if money went to the educational system for mental health, it went there. But we know that within our educational system, we lack social workers and other health professionals in our school system. So I don't know exactly where the $10 million went, but I consistently hear from teachers and paraprofessionals and others talk about the lack of support around mental health in our public school systems.
Oh, Madam Chair, I think you raised it easy. You raised a most important point is we still operate in silos. I mean, we are an agricultural community, right? We still operate in silos, and I knew the chair of the committee that's parallel to your committee over in the Senate, Senator Abler, when he was a House member, I said that. When he was part of the lower body, he actually, that was supposed to be funny, Rena. I'm sorry. He initiated those aspects, and I just think there's something there that's missing, right? And I keep coming back to the theme that you just said. Where's the coordination, comprehensive, and collaboration? Is there something that we need to do statutorily that says what Ms. Sommerfeld's already starting to do, right? But how do we enhance that so we force that to happen? And I don't want to say force it, but
and we don't need to do it statutorily. As the chair of the Health and Human Service Policy Committee, I had a committee hearing with education policy around trauma-informed policies and practices. So we can do it. We just have to learn how to do that, and because we don't live in just an education arena or healthcare arena or public safety, they intertwine with each other. So Representative Damon, right?
Very good. Thank you, Madam Chair. To the testifier, I appreciate the outline of things that you would like to look forward to and the things that are planned to be done. I also appreciate the differentiation between policy only and then those with a potential cost to them. Along with this year looking to align the foster care and the adoption piece, how are you going to prioritize the things that you've laid out besides the one that you've said may come forward this year? How are you going to prioritize? Because in my mind, these all matter, and they all need to take place now. But what type of process are you going to use?
Ms. Bailey.
Madam Chair, Representative, excellent question. And we've been working on this for about the last 8 months, trying to come up with what's the best way to receive input so that what we're proposing is something that the community wants and needs and meets those needs, but also that it's capable of being implemented. in terms of the policy proposals, those are things that I believe are already on their way to be put forward this year. Other things that are some of these are things that we may be proposing to the governor this year, that we're still in discussion about that, and then also in discussion with members of this body about how we could move those forward. In terms of prioritization, that's something we're still continuing to discuss, I think, and receive input. I think the support for the community-based agencies is something that we see as really could have a large impact relatively quickly, as quickly as these things happen. But in terms of other things, we're open for discussion on those.
Thank you.
And
Nothing further.
Representative, also, my hope is that we can also take this out to the community and engage the community in, some of their priorities in the African American community, in the Black community, but also for the parent representation bill, I'm carrying that because I believe whenever parents go into a courtroom, they should have representation, right? There's no other entity where you have been accused of a crime or whatnot that you do not have representation. So I'm working with a coalition of folks on that piece. I'm also working on the looking at the aligning adoption and foster care. There's no reason why we have so many barriers in place for if you want to be a foster parent, that is not there if you want to adopt. So we're working really hard on that and trying to engage the Senate in that process so that we can really just align those barriers or that is within the adoption arena to also foster care. In that way, we can get more family members to be foster parents of their grandkids or their nieces and their nephews. So we're working on that piece right there. And there's a few other pieces where I'm trying to be in conversation with, like Ramsey County. It's really important in the county that I represent that I see better outcomes for African American kids. So I'm working with them. I have been told by Ramsey County that 80% of their kids now are being placed with kinship.
Okay.
Right. I had conversation with Hennepin County. I didn't get the percentage, but I hear there's a larger amount of kids in Hennepin County, African American kids, who are now being placed with family members. And I'm still working to look and see what's going on in St. Louis County, because we do know in Duluth there's a small population of African Americans, but they are having encounters with the child welfare system in high numbers.
Okay. Thank you.
All right, thank you. So we're going to move on. If we after Jamie Sorensen's presentation, we will be taking public testimonies. If you would like to speak, please sign up. Is there a place? Okay. And if you have come into the space and have not signed in on the clipboard, please sign in on the clipboard so we can stay engaged around who's in the room. Thank you. So welcome, and thank you for being here today. Please introduce yourself.
Jamie Sorensen with Department of Human Services, the Division Director for Child Safety and Permanency here in Minnesota. And Representative Moran, Madam Chair, and committee. What I'm going to be reviewing is a two-page summary that's been laid out, I think, in a pretty digestible way that highlights data from annual reports that are required to be produced by the Department for the Legislature on maltreatment in the state of Minnesota and also out-of-home care. And so this two-page summary represents about 150 pages of report data. On the two-page summary, you can access the actual reports at the link identified. In walking through the report, looking at figure 1.1 first on the first page, it will show you information about really over time a pretty substantial increase in the number of reports received by child welfare agencies throughout the state. And since 2009, there's been a 78% increase in assessments and a 74% increase in investigations and alleged victims, respectively. And so part of what we saw as a result of the work of the governor's task force in 2015 and the 93 recommendations that flowed from that task force was an increase in the number of reports made to the child protection system. What you'll see is a slight increase in the number of investigations that have been conducted. That was a focus of the task force, and I'll hover here just for a moment on family assessment and family investigation. Family assessment is an involuntary child protective services response, and it's targeted toward maltreatment referrals that generally include allegations of neglect or lower risk types of reports to the local child welfare agency. It is a methodology that does not result in a maltreatment substantiation determination. And then there is family investigation.
Mrs. Sorensen, are you referring to this document?
Yes.
So for the audience, if you have, you can see what he's speaking about. If you have this document, which is a 2018 Child Maltreatment Report Summary.
Madam Chair, looking at family assessment and family investigation, over time in Minnesota, we have seen it be in a strategy that has some polarizing views. I think if there are changes to family assessment, there should be a really thorough analysis, because the tribal child welfare agencies within the state of Minnesota, particularly White Earth and Leech Lake, use family assessment significantly because they believe it to be culturally aligned. And also we see that there is overrepresentation of maltreatment referrals for African American children and families, and so a change to family assessment would also greatly impact those parents and those families. Moving on to figure 1.2, it talks a little bit about the rate of referral to the maltreatment system, and as you can see, American Indian children and families reported at a level 5 times greater than their white counterparts, African American 3 times greater, and then children who are identified as 2 or more races, 2 times more likely. The children who are 2 or more races, a large portion of those children identify as African American. And then figure 3, 1.3, tells you a little bit about the types of referrals that are received in Minnesota, and you can see that largely the referrals made to the system are those involving neglect, about 60%. And we do see inherent in a lot of referrals involving neglect threads of things that look like poverty, whether it's related to income, housing, food, transportation, clothing, childcare, those kinds of provisions for children and families. And so we have to ask ourselves the question, to what extent are they, is the child maltreatment system the appropriate way to address some of those needs that are brought forward to the local child welfare agencies? The other side of the page, starting with figure 2.1, goes into the annual report related to out-of-home care and permanency. And a couple notable things in figure 2.1, there's been a 10%, in 2018, there was a 10% reduction in the number of children entering out-of-home care in Minnesota. It's really the first time we've seen a decrease in that entry rate since the task force. We did, though, at the same time, see an increase of 7% of those children remaining in care. And what we know about that is the opioid epidemic and parents who, children who entered the system with a primary reason of parental substance use generally spend a longer time in out-of-home care while parents receive treatment. And some of these statistics you've heard already this morning. African American children 3 times more likely to be in placement. Children of 2 or more races 5 times more likely. And again, a large portion of those children identify as African American. And then American Indian children 18 times more likely to be in placement than their white counterparts in the state of Minnesota. Also, a large percentage of children under the age of 3. Children under the age of 3 represent about 16% of Minnesota's child population. They represent 24% of the children in out-of-home placement. And then also children with a known disability represent 4% of the child population in Minnesota, but they represent 27% of the children in out-of-home care. And so you can see over the rates per 1,000, and I think that gives you a very equalized way of looking at the representation of children in out-of-home care. You can see in Table 2.2 why some of the children are the primary reason children are placed in out-of-home care. And we can see in Figure 2.3 that 87% of children are supervised under county, local child welfare, social service agencies. Of all American Indian children in care, 55% of those children were supervised by tribal social service agencies in tribal court. And you can see in Figure 2.4 information around length of stay in care. I think what I want to highlight here, and I think it speaks to the importance of attending to the system's interface with African American children and families, is that 20% of those placements are for less than 30 days. And that should indicate to us that there are perhaps other alternatives to placement if they are short-term placements across the board. And that, clearly they are placed for a shorter period of time at a much higher rate than their white counterparts. And so I think it speaks to reasonable efforts to safely keep children with their families. So these are rich reports. They are reports that are required by the legislature. They are submitted annually. There are links to them. I know that we have still significant pieces left on the agenda. And so I'll leave it at that, I guess, unless there are questions from you, Madam Chair, or members of the committee.
Yes, I have a couple of questions. So I was looking at Figure 2.2, and it states while children entering care. And for Native American children, they were 1.2 times more likely to enter because of substance abuse, which we know opioids is rapid, and 1.6 times more likely to enter due to neglect. But African American children are 2.5 times more likely than white children to enter due to child delinquency. What is child delinquency?
That is when you look at the out-of-home care permanency report, what the children that are included in this data are children who are served in Minnesota's behavioral health system and also the correction system. And so what this particular figure is pointing to is those kids who are beginning to bump into the law and are entering the juvenile justice system in terms of their array of services and placements and those kinds of interventions.
So delinquency equates to corrections?
Children who are under delinquencies are served by the corrections department in Minnesota, yes.
And they're four times more likely to be supervised under corrections than white children?
Yes.
Can you talk a little bit about that?
I can speak to it, I guess, from a couple of perspectives, Madam Chair. One is we know that in general data that African American individuals are at a higher rate the subject of law enforcement intervention and also referred to systems at a higher rate than their white counterparts. And so I think there is probably a disproportionate rate of reporting and focus on these children and families. And then secondly, as we look at children who have been perhaps involved in the child welfare system, as kids get older and go through different developmental phases, some of those traumas that have been experienced in younger years can start coming out in different ways, and bumping into the law is one of those.
So I think when we look at the Family First Prevention Act, that's more about being more prevention, more intervention, but also with a priority around keeping children with family, that we, within this Family First Act, that we would, do you see a change in practice? What are you seeing? Or what do you think may happen?
I don't know that I would be looking to the Family First Prevention Services Act at this moment in Minnesota, because I think what we need to understand is that the evidence-based services in the federal clearinghouse are not necessarily services targeted toward African American children and families at this point in time. And it remains to be seen if they will be in the future. And so I think what we have the obligation to do is think through in Minnesota, whether it's through the African American Family Preservation Act or the piece of work that was presented by Assistant Commissioner Lisa Bailey, how we attend to the needs of older youth as they are transitioning. So whether that's related to how they are accompanied, or if they're homeless, or if they're engaged in other kinds of behaviors, but programming for explicitly older youth.
Senator Hoffman.
You got an hour? No. I just am absolutely, the same numbers that we're talking about here were the same numbers when I was in 2001 to 2004. I was in the Federal Interagency Coordinating Council under the Bush administration, and there was a guy named Miles Golson from the Children's Bureau, and they're the ones who federally oversee the foster care, and the numbers that we're seeing here, this 24% of children under the age of 3 compared to 16%, the 27% of children that have a known disability. I'm frustrated that we have done nothing as a system to move that benchmark. But the thing that gets me now is you during the trauma, when you have a child that has seen the parental substance abuse, regardless, right, there's going to be some trauma. And if our methodology of how we treat the correction side or we treat the social services isn't including that dual issue of trauma-informed, because you're dealing with something that happened, especially if it's before age 12, right? We know that it's going to be. So I think my frustration should lead to us taking a larger look at the system and saying, okay, how are we incorporating, and I just think it's got to be some comprehensive coordination that occurs. Now, I understand in other states, the Department of Human Services licensed those juvenile detention centers and juvenile correction centers. Is that correct in Minnesota as well?
I don't work in the licensing area, and I don't work for the Department of Corrections. These kids are reflected in our out-of-home care report, but I'm not probably the person to respond.
And here's another connection. So that's probably a true statement. I don't know off the top of my head. I'm sure somebody out there knows more than me on that. But the other system that should be integrated, and there's the children, no matter where they're at in Minnesota, right? The Article 13, constitutional right to free public education. If 27% is true, which is a high disproportionality according to just the general population of 4% that might perhaps need. Where is the Department of Education regarding the special education and/or related services that are also there to enhance? So, again, I guess the thing comes back to thank you for doing your work on the trauma-informed, but how are we really pushing the systems to stop operating individualistically and start looking at the whole child and saying what is going on? I think we're starting to move there, but from 2001 to 2004 to now, it's still the same stuff. Is that
Yeah,
helping?
we have work to do. And the governor cabinet is bringing them together. Yeah, it's bringing them
Is the
together.
children's cabinet?
Commissioners. Yes.
Thank you.
They're working on it, but we still have work to do legislatively in the legislature, right? So that we can begin to operate that way too, that chairs from different committees are talking to each other through a more holistic way.
I mean, it was kind of interesting, Madam Chair, that you bring up, and I'm glad you said the Children's Cabinet is really looking. That absolutely is the entity to do it. Years ago, Minnesota created Children, Families, and Learning with the same conceptual idea of putting all the children's services under one umbrella. Of course, that went away, but at the time, I remember saying, wow, that was brilliant. You guys are actually thinking comprehensively here. So I'm glad we're on the same page on that. So,
Do you have any input on?
You know, Madam Chair and Senator Hoffman, I guess a comment I would offer based on the information that's provided here, I think that what this clearly shows is overrepresentation of African American children and families in the system and in out-of-home care. Same with American Indian children and families. In our thinking, we sometimes get stuck and we think the goal is to address that overrepresentation. And that is absolutely part of the goal. But that is just where we stop the system from doing harm. And what we need to do is we need to develop the system so that integrated into our policy and practice is the lived experience of community, and that the services and the interventions available to people who need help and support are accessible, culturally relevant, and driving toward outcomes that are meaningful to community.
Well, thank you so much. I appreciate your work and the presentation, and we're going to keep in mind that there's still so much we need to do, that we must do. So what we're going to do next is we have a list, a very long list of testifiers.
We're not done. I need that list back.
Okay. So we have a very long list of testifiers. We have some who signed up online, and we're going to go through them first, and then we'll go to the list of signatures. It's a long way from here. Okay, why don't we start with Sarah Ingberg. Sarah Ingberg, Khalees Houston, and Barb Brittle can all come to the testifying table. Khalees and Barb. Okay. Okay. Yeah. Please introduce yourself.
Thank you, everyone, for having me here today. You will have to excuse me. I'm extremely nervous.
So we have a very long list. We're going to give you about 3 minutes to speak. Okay. Okay, please.
I'm sorry, but I do not mean to be disrespectful or offend anyone, but you all are missing the mark. To say that you understand that reforms are needed, but they are not going to happen until 2021. You are leaving our children behind. My journey with Child Protective Services started when I went to pick my 3-year-old and 11-month-old daughters up from preschool, and they were not there. All of my children were taken into custody, and all contact with my children was cut off. While I am now allowed visits 5 times a week with my younger children, I have 3 older children with whom I have not even been allowed a phone call in 18 months. My children were removed based on a third-hand report of possible neglect. Since then, my children have been subjected to physical and sexual abuse that were never part of the home environment. Numerous lies on the part of the social worker have been well documented, as well as my compliance with our case plan. Still, the county is moving forward with termination. Our only right seems to be continue to move forward to a trial where the court will be closed to media, advocates, legislative committee members, and all other onlookers. We need common sense child protection reforms today. We need accountability and oversight of every case where termination of parental rights is being recommended. There should be no more closed proceedings. Furthermore, as soon as children are removed from the home, services and eligibility is reduced so that we are taking resources from families when they need it most. Child protection workers are able to give resources to families that they feel are most deserving, and parents are complying with child protection plans without even having a stable home. And I think that a housing first strategy needs to be in child protection, where we are housing families so that they can work on the reunification. I'm just gonna pass it on to the other people who came to speak today. But we need protection for our families against perjury and retaliation in the child protection system, and we need this today.
Thank you. Thank you. Please
You want me to
introduce
go
yourself.
first? All right.
Introduce
so
yourself.
My name is
please.
Chantel. I'm coming, sir. I'm coming. My name is Chantel Allen. I am the head of Black Lives Matter Twin Cities. I'm here to represent that. I actually wrote something for the first time. I'm not going to come in here because we're early in this process, and I hope that you guys can honestly hear me out. Racist, anti-biased, or non-racism, anti-racism, and white supremacy are all very different things. I see you guys addressing anti-biased, and that's good, but it's white supremacy that created these disparities. And it's also white supremacy that allows for a report to come out years ago and for them to just start addressing it 8 months ago. I'm concerned about the representation throughout this whole process. We heard a great start, but how can we get our elected officials to hold people in the power of these institutions to the rights entitled to ADOS people, African descendants of slaves? Are we going to continue to allow business as usual, or are we going to demand some urgency so that we don't keep showing up the top 5 worst states for ADOS people? It just keeps happening. In this presentation, they said the federal government will only flip part of the bill, and I'm going to ask that you guys go and actually fight for some of that supplemental budget to actually start to restore some of the wrongs that has happened. We recognize through the report that clearly there was some injustices that were made, right? So what are we going to do to start to restore with those communities? We can't just come in and say, oh yeah, again, we know what's best. Because if you knew what was best, it wouldn't have created those disparities in the first place. I'm going to strongly urge you to please hear the communities, go into the communities, let communities be part of this process, allow communities to identify where these problems are at, and as you continue to move forward, and to hear the communities out. I think it's important that we have a lot of professionals with a lot of credentials and we fly people in who have all these, best practices, but who knows best about our children are our parents. And I urge you strongly to please listen to the parents today. Thank you.
My name is Khalees Houston. I'm the founder of Village Arms and an advocate for African-American families impacted by child protection. I want to start by saying that it's unfortunate that this legislative task force didn't find this hearing important enough to attend. For half of the folks to be absent on such an important, it's the first hearing of the year, to be absent is quite telling. I would ask you to support and really push for DHS to support the African American Family Preservation Act as a means to not only reduce but eliminate child welfare disparities for African American families. None of what was proposed today regarding the Families First Prevention Services nor DHS's bill to address African American inequities is going to reduce the number of our children in care. For over 40 years in this state, we've known that this has been an issue. And what DHS has always done, what this state has always done, is thrown pennies, crumbs, and a few dollars to outside agencies and entities to address an internal problem. The African American Family Preservation Act works to change the internal practice issues that are perpetuating child welfare disparities. Even the child protection laws that we have as protections are not followed when the families are African American. We've seen, and I've worked in child protection for over 5 years now, we've seen social workers lie. We've seen them fabricate evidence. We've seen them ignore the statute that says that you have to create a safety plan before you remove children. No one receives a safety plan before their child is removed. We need actual law, and I have provided a bill overview of the African American Family Preservation Act, which requires active efforts, not reasonable. Reasonable efforts will not do what we need it to do. Reasonable efforts right now can mean anything. A social worker can come into court and say, I tried. We need it documented, and we need a concerted effort and ongoing throughout the case to address the issue of out-of-home placements and the fact that our children are not placed with relatives. Over half of the children that we're removing in our largest and most diverse counties are African American children. So when we're up here with the lingo and the systems folks talking about the issue, they're talking about black folks without black folks. None of the community that's impacted was involved in DHS's creation of what they call the complementary bill, but it gives monies to nonprofit agencies. So those that run nonprofit agencies are behind DHS's bill. We don't want the crumbs. We want policy and practice change, and that's what this bill does. We spent $505 million on child protection services in 2016, removing about 15,000 kids. Only 9% of those kids have been removed because they were being physically abused in the home, and only 2% sexually abused. We are not keeping kids safe in the state of Minnesota. And because this task force did not find the parent voice important enough to add to the agenda, I am giving my time as well as Barb Prindle's time to parents so that this task force can hear from those most impacted. Thank you.
Thank you.
Let's give space for ADOS parents, please, to speak.
So do we have Dwight Mitchell? And
I'm still taking my time. Barb Prindle was after me. Barb Prindle is giving her time to parents. Do we have any ADOS parents that would like to testify about their experience?
wait a minute.
Annette, take
Wait
this
1 second.
time, please.
Wait a minute.
Sit down.
Wait.
Sit down.
I have a list here.
Any other parents would like to testify?
You using your time?
I'm using my time. Thank you.
But listen, but you can't direct the way this is ran.
Can I'm a parent.
So,
and I want to.
Excuse me.
I want to get my statement out because I gotta go.
Okay. Excuse me. Would you introduce yourself first?
I'm Desmond Reed, and I'm from Hennepin County. A parent of 3 children that was taken in 2017. Because I was arrested for domestic violence, which eventually got dropped 4 months later. Even though this criminal charge was dropped, they took my children, they took them from school. They didn't let me know that they was going to do that. They gave me a phone call afterwards and said my children was gone. So when I went to court. They told me that you had to do a case plan. I said, okay, I'll do the case plan. What the case plan consists of? Domestic violence prevention, which means I had to take a class for something that I didn't get convicted for. So this is a violation in the Minnesota constitutional rights. Substantive due process. Double jeopardy, Section 7 due process. Double jeopardy and substantive due process, meaning that I have the right to do what's best for my children. I did call the police. They arrested me. They didn't ask both parties what happened. They just arrested me because they asked the lady. The lady told them that I strangled her. The charges was dropped 4 months later. Straight in the gate of me going to court, they violated my constitutional rights. Straight in the gate. Yeah, I had legal representation. It's going to be a lot of people coming under fire because of this. A lot of your colleagues. Because I'm just keep that until later. But it's going to be a lot of people coming under fire because I have the proof that my rights was violated. They probably didn't think that I was going to go and defend my own self. They left me out there to hang, you know, thinking that I wasn't going to go into the Minnesota constitutional rights, Minnesota Constitution to see what my rights were. Then I went into the Department of...
So have you, so what's going on with your children?
My children were taken from the mom, given to me, and taken from me. But I was rewarded custody at the end. That's in October 7, 2019. The case started in 2017. So...
have they been reunified?
I did get my children back. During the process of my children being in custody. Now, remember I just told you, they took my children.
We have a long list. We'll give you like 2 more minutes.
Okay, I only need one. Remember when I told you that they had took my children because of this charge, which was maltreatment, neglect, and it really wasn't no imminent danger of my child. I called the police. That was my way of protecting the children that I had. That's my children. But when they got into the system, my child was sexually assaulted by 2 other children. My son sexually assaulted by 2 young ladies, 12 and 7. They was adopted. They was a part of that family structure there. My children were just foster.
You know, it would be really good if, like, because DHS is here, the county folks is here, that they can see you, because that is where the issues lie with the county and DHS. You know, your story is the story of so many other people.
Yeah.
Right?
Yeah. They ripped me apart. They ripped me apart.
I'm glad you got your children back.
But I defended myself to the tooth and nail every day, every chance I got. When they came to visit me, they had nothing on me. They kept trying to figure out how they was going to get me.
Thank you, Dwight. We're going to let other people.
His name is Desmond.
I'm Desmond. I'm Desmond Reed.
For the other task force members, we've shared with the chair and others at the legislature that DHS and the county refuses to hear our voice on this issue. DHS answers to this body, and that's why we're here speaking and appealing to you to hold them accountable. Everyone at this table may not care, but I'm asking those of us that do to please hear the parents.
Okay, we have 2 other people that please go forward. Give me your name. We need to get Dwight because he flew in from out of town and he would like to speak also. So if you don't mind letting Dwight go first, that would be helpful. Thank you, Dwight. Go ahead.
Thank you, Madam Chair. Committee members, my name is Dwight Mitchell. As Madam Chair mentioned, I flew in from New Jersey. I am the Executive Director of Family Preservation Foundation. We have an office here in Minnesota and one in New Jersey. We're a non-for-profit 501c3 legal interest organization that's founded on the idea of rescuing children from unwarranted forced parental separation. A lot of what these family members are speaking about today. Before I start my public testimony, I just want to give you a little bit about my background so you'll understand why I found the foundation to represent the parents and what we're trying to achieve.
I have to give you 3 minutes, Dwight.
With family preservation. I'm a management consultant in the computer industry. My sole focus is business process reengineering for some of the top companies in the world. My clients are like Viacom, Merck, Mobil Oil. I go into these organizations, I look for inefficiencies, I re-engineer the organizations, make them more efficient and more profitable. So after I was dragged into a CPS ordeal while working for CHS here in Minnesota, doing a $27 million project, I experienced the same things that these parents experienced. I was brought to court. I happened to have the ability to have legal counsel, but even with legal counsel, things were happening that should not have happened. You know, it's kind of interesting when I look at what's going on and the disparity and what we're trying to achieve. And today, my testimony is really based on a Russian proverb called trust but verify. So because I'm a very data-driven individual, what I have actually done is looked at the DHS reports, used the Data Privacy Request Act, obtained information from the judiciary, and I wanted to share some of this information with you so you'll understand why all of the children are being taken, and there is a disproportionate amount of minorities being taken in Minnesota. So to drop down to my findings, since I have limited amount of time, as reported by the legislature, by DHS, there were 35,615 new cases in the past 5 years that went to court where there were allegations of child abuse. My question to the judiciary was, out of those 35,615 cases, how many were represented by attorneys at the 72-hour hearing where the child was removed? And the answer from the judiciary was 6,699 cases. So my next question was, during the past 5 years, out of the 35,615 cases that were supposed to commence to trial, meaning in 60 days a trial is supposed to be given to all of these parents, where social services is obligated to present evidence to the court of maltreatment. And I said, how many cases proceeded to trial in the 60 days as required by law that you, the legislatures, set? 488. So when you sit here and you look at what's going on, my next question was, okay, well, out of the 35,615 cases, when they actually, went to trial at the admit deny, how many actually had attorneys? And they said 16,696, where most of those were public defenders. So I sit and I ask you, your laws, your legislation is not being followed. The county social workers are actually having the parents conform, do case plans. They aren't providing safety plans. And in a 5-year period, what really happened is that 68,786 cases or children were held in foster care without a social worker having to substantiate any of the allegations against the parents. So this is from the Minnesota judiciary compared to DHS annual reports. They're on our website. So when I came back and I looked at this, and so then I went to look at what was being done, there's the United States Department of Health and Human Services, AFSCAR, they do all the government reporting. And so I went to see how much Minnesota spent on foster care in the last 5 years, and they spent $2.5 billion. That's $1 billion over the course of the last 5 years, and received $792 million of federal funding for children where child abuse allegations were never substantiated in the 5 years, in the 60-day time period that's required by legislation. So, you know, I ask you to picture yourself in this situation. Now, I could afford an attorney, and I was still taken through the ringers. What was interesting is my first 2 children were given back to me in a relatively short amount of time, but it took me 22 months to get my 3rd child back. And my case was dismissed.
I'm going to need you to wrap it up.
So what I'm really looking to do right now is, I don't want to talk about the foster care outcomes because I actually had that down as part of my agenda, but what we're actually looking for is that the parents are not receiving, in my humble opinion, due process. And that's where we come in. So with family preservation, our number one goal is to keep children out of the failing foster care system whenever possible. The number one thing I would like is for parents to be told their legal rights, similar to the Miranda rights, you know, at the time that a child is removed from the home. So they can at least be prepared for the first hearing. They show up at court and they don't even know what to expect.
Yes.
We recommend that a pamphlet be handed out. We would also like for parents to be told about our website. We have put together a pro se
Do you have a
document.
one-pager that you can leave behind?
I do.
Okay, let's please pass it. I'm going to have to wrap it up because we have a slew of folks, and I want people to also feel like they was heard today.
Understood.
Okay?
I welcome the opportunity. Our organization would like to work with you on having further discussions, reviewing our material. We would like our material to be mandatory to be given to the parents, our website to be mandatory. We're willing to design it to comply with whatever the committee feels is necessary to make it unbiased, to get the word out to the parents.
Thank you. Thank you so much. So I would like to introduce to everyone a former legislator here in this body who worked real hard representing Minneapolis, former State Representative Linda Slocum. Thank you for showing up today. I really appreciate your work and your leadership. Is there something you'd like to share with us, or you want to come?
Very briefly,
Yeah.
I'm not going to take any time. I've worked with you, Representative, and with Khalees Houston extensively. This needs to happen. This is what I've done in my retirement. I am working so hard to see that equity is achieved, and this has to happen.
I agree. And I want to apologize for all of you who showed up today I would like to apologize, too, for the members who did not show up. We have been planning this for a very long time, making concessions because of people's schedule and conflicts. And, you know, here we are. So I just want to apologize, too, because, you know, speaking to me, I know this stuff back and forth. Right? So I really apologize that we don't have an audience for you to talk to. But I also would like to share with you that what I know and what I believe is that we have members from DHS. And if you have an open case, if you have something that you need to talk about, everything is about this. That take some time to turn around and find someone from DHS and sit down with them and let them hear. In this room, look, in this room today, they are there. Take the time to make the connection today. This is about your baby, your family. Just if you don't want to, you don't have to. That is only my humble suggestions to those who are fighting a system right now to take that time to invest in talking to them about your child. And you don't have to if you don't want to. That's up to you. So I'm going to pass it on to the next, to the, Dwight.
Yes.
Dwight, I want to thank you for sitting there. We're going to,
This is an individual basis type stuff.
well, let people tell their story. Let people have their chance to talk. That's what you came here for. Let them have a chance to talk.
Madam Chair,
It's all about you guys. It's all about
I'm
you.
going to give a
Can you please introduce, I'm sorry.
Madam Chair, I'm going to give the seat right now, but before I do, I just want to say one thing. If you're really serious about decreasing, disparity, what really needs to happen is legal representation.
I got a bill. We're trying to do that. We're working on that. I want these other two people to have an opportunity to share their story.
Thank you, Madam Chair.
Thank you. Please introduce yourself.
Yes, my name is Annette Bryant. And my children were stolen in 2001. I'm a mother of 6. My children are still affected. They are young adults having their own children. Yet the system failed me and the system failed them. I was never charged with anything. I didn't have a drug addiction. I wasn't on alcohol, anything. Yet the system ran me through this. My 2.5-year-old daughter was sexually abused in one of the foster homes. I was prevented at some point from seeing my children. They told my children that they would never have an opportunity to see me. I fought. I fired the public pretender, because that's what they are. I hired an attorney, and I was able to get my 2 youngest back. My 3rd son, he had to age out the system, and he was even sexually abused in the system. The workers promised these children so much. They say, if you tell us what happened, or if you go along with this, we will allow you to go back home. And the children, they stopped talking to all the services. All the therapy doesn't work. Because when you keep promising children that they are going to be able to see their parents again, and they're not, the children are falling through an open crack. And if it wasn't for me standing up and fighting and finally saying, I'm not signing anything else, because my 3rd son, he was only supposed to be in long-term temporarily. Yet the garden of Lightham, she was fired. We had 17 workers. And I'm like, if you wanted me as a parent to be stable and have stability, but it's a system that's not even stable, because how do you address that? And what workers said, we apologize because we don't know what happened to your case. To this day, if I need any services from the system, all my stuff is blacked out. What does that mean? It's like, it's stuff that still goes on, because my children are still suffering from the effects of the system, and they are young adults to this day.
It is traumatizing, and we know that. Yep. Well, thank you for being here today and sharing your story with us. And I agree, we have an unfair system.
Thank
you. All right. Please, introduce yourself.
My name is Darrell Mitchell.
Yes.
I'm here today because my daughter was stolen from me. She's 4 years old. Basically, I was trying to prevent her from being taken from me, and there was just nothing being done as far as calling child protection and following up with you guys, doing interviews and things like that. I had you guys at my house multiple times, plenty of interviews, and she still was taken from me for lies and pretty much white supremacy and racism, all here in Ramsey County. It's crazy to me that, I'm going to child protection for help, and you guys are making matters worse. There's no reason that she was supposed to be taken from me, and I do want her back right now. I'm here to figure out what you guys are going to do today so I can get her back, because the things that the laws and stuff that you guys have put in place is putting these disparities on these families, and it needs to stop today.
Darrell, It's up to you. But I would like to suggest to you, if your child is still in the system, there are some DHS workers behind us in leadership and management supervisory roles. I would like to suggest for you to go and talk to someone behind you over here and share with them who your daughter is and how you can see her if she is still lingering in foster care. Now,
Why doesn't DHS come fill these empty chairs?
Because
Eye contact.
Because
Take it seriously.
it doesn't work that way.
Let them stand at the carpet.
Where are they at? What's their names?
I just, if you guys can move back over, you can view them where they are, have a conversation with them. That's up to you, though. That is up to you.
I think we should all have a conversation.
So please, introduce yourself and share your story.
Good morning. My name is Melissa Jones. I have 2 daughters. I'm a single mom. My dealings with CPS, at the time, I was asking for help and referrals because I had some behavioral problems out of my oldest. And I took her to therapy, which was what they normally would tell us to do. And instead of them focusing on the issues and taking my concerns seriously, they called my mental health into question. They made me take 3 different mental health assessments. And the last one, it clearly states that I can manage a household and raise children. My relationship with my family has been completely obliterated because of all of the lies and the deception by CPS and everybody else involved. I've gone through the court system. I tried to meet with my public defender and get defense strategies. I gave him a list of people that would speak on my behalf. Nobody was called. Right. Nobody said anything positive about me. They said nothing but negative things about me. Unfortunately, I did have a case open with them in 2010, but I paid my debt to society and I changed my ways. And I promised myself and my children that wouldn't happen again, and it hasn't since.
Good job, Mama.
But they kept saying, oh, it happened before, it's gonna happen again. We don't think she'll ever change. She's never gonna get better. When people hear that I have my own home, when people hear that I'm working a job, when people hear that I'm going to school, they're surprised. Because of what? I'm not supposed to have anything because I'm black?
Right.
Since my children have been out of my care, they placed my children not with family, not with relatives, but with someone that has the same last name as us. She is not related to us in any way, shape, or form. They used my information to get my children hooked up with community programs, summer camp. I know this because I got an email saying, thank you for signing your children up. But yet, these are the people that we're supposed to be trusting to help us, to support us. Since my children have been out of my care, my youngest daughter has been exposed to pornography. She has been exposed to playing little kiddie family games, laying naked with other people that she doesn't even know. My children are giving electronics, and they're told to get out of the person's face until we're ready to deal with you. Every time the lady has interactions with me, she takes an opportunity to downgrade me, talk negative against me. She has nothing good to say about me. But yet to everybody else, to my mother, to people that are trying to support her because she has my children, she wants to make it seem like, oh, I'm the best fit for the parents. I know how to successfully raise kids.
Have you lost your parental rights?
I was following the case plan, and they kept switching it up to make it seem like I'm unstable.
So you have not?
And the only choices that I had was temporary termination, or they were going to take it. And so I voluntarily terminated my rights because that was the only option that I had. Nobody throughout this whole thing, nobody explained the system to me. Nobody explained the laws to me. All people have been doing has been using my past against me.
I'm sorry, yeah.
And so my oldest daughter, she suffers from depression now. Both of my children are depressed right now. I just had my youngest daughter, and she broke down saying that she's tired of being yelled at. She feels like she's lonely. I broke down because I'm their mom. What else can I do? Everywhere that I have gone to get help and support, and for people that know the law more than me, that can advocate for me, they have turned me away, and they have believed that I did whatever allegations were said. I have no help and support.
Well, I'm sorry.
I get to see my children regularly.
You? That's good.
I get to see my children regularly,
Make
but
it
that's
as-
not enough. They
yeah.
need to be home with me.
I agree.
Even the county has said these kids need their mom. If they need me, give them back to me.
How long has it been since you lost your parental rights?
5 years.
We have a policy in place that we just passed. So you check to see, can you get your parental rights reestablished? Have they been adopted out? They've been adopted out. Well, that's, yeah. I'm glad you are able to see your children. Make every moment the most powerful moment that you can. Let your children know that you love them. Give them all the love that you can, that they need, because they need that right now, right? They need to see you strong in a moment when it's not easy to be strong, right? Because this is having a real impact on them.
Yes, and I would also like to add that in terms of prosecution coming with evidence, there was no evidence of abuse or neglect found in either of my children,
I can
but they
believe you.
neglected to share that with the judge.
I can believe you. Yeah. All right. Thank you. Please introduce yourself.
My name is Amanda Mercado. I have 4 amazing children that were removed wrongfully from me. Their names are Emilio, Amaya, Elena, and Ariella. My children never reported abuse. They have never had any signs of abuse. But what happened is some false reports were made against me by my ex's parents, who had wanted to file for custody of their grandchildren. They only wanted 2. They didn't want all 4. They offered me to drop all of the reports and we'll make everything go away if you agree to sign custody of the kids. And I said, get the hell out of my face. And at that point, there was stacks of reports made by the wife, husband, and oldest son. So because their custody battle wasn't going in their favor, they started making reports. And to me, that says the system is extremely flawed if it's that easy for someone with malicious reasons to just come out of nowhere and to start in and to know the system that well, because she's a school teacher. She's a St. Paul public school teacher, and she's a mandated reporter. She knows what to say. She previously has had multiple children in her home. She already had her foster care license. She's done this to 3 other mothers, all moms of minority mothers, low income, different issues that they had, whether it be substance abuse, domestic violence, housing issues. I have a PTSD diagnosis, so I was an easy target, and I was the idiot that gave her her first real grandchildren. Her husband got a vasectomy behind her back 15 years ago, and since then she's been obtaining custody of children by getting close to parents who are easy to get close to. She was an early childhood family education teacher. She was a doula for young at-risk mothers. She offered to let mothers come in and live in her home in exchange to help her with her kids. So she makes these false reports, and it's easy for her to manipulate the system. And it starts, I think, I really wanted to talk about my kids, but I'm going to tell you, it starts at the very beginning where the reporting comes. Right where the reports come in, and when you guys are getting these phone calls, why is it so easy for kids to just automatically say, okay, we're going to take this case, and do you not look into who's making the reports? Why is there not a system to look at repeat reporters who make false accusations? Why are these reporters not flagged? Why are people not looked at and seeing, are they targeting minorities? Are they repeatedly making reports? Are they a school teacher? Are they a doctor? Why is that not being monitored? I think that is one big, huge factor of it. My children were taken 4 years ago on false accusations. It turned into a CHIPS case. This person, it's the Moser family, they motioned themselves into my CHIPS case. And then when they motioned themselves into my CHIPS case, they did it in a sense of, hey, we can take the children. They've already been coming to our house on the weekends. They're comfortable with us, and we already have our foster care license from North Star. That's a little convenient. So my kids are with them. The custody stuff gets put on the back burner because Chip's case take precedence, as it should. Children's safety is top priority. But nobody actually ever heard my children say that my mother's ever hurt me. There's never been any reports of actual abuse founded. And the whole Chip's case just got drug out and drug out and drug out. And we were supposed to be at the 6-month check-in and the 90-day check-in and all of these check-ins. Why did I have multiple workers come and go?
Currently,
Multiple guardian ad
excuse me for 1
litem.
second. Are your kids still in out-of-home placement?
Oh, this woman, she got a harassment restraining order placed against me, and I haven't seen my children as of this month in a year. They have been out of my home for 4 years.
And you have not seen
Because
them?
I had showed up at her home with the original order from the judge stating that I get my children on set days, set times. I never lost my parental rights. I didn't lose custody. The Chips case,
So do you still have your parental rights?
I do, and I know where I'm going next. I honestly don't need any advice. I know what I'm doing, I know where I'm going, I'm
Well,
helping other parents.
Well, that's my
But-
point too, and I'm glad that you know what to do, because that's important, because your kids are dependent on you to know that, so I'm glad I
A
don't have
lot
to
of
share
kids are
anything
dependent on the
with
people
that.
out here speaking for other
So,
children.
If you still have your parental rights, I'm happy for that.
I know what to do.
We was going to end today at 12 o'clock.
That's
audience,
fine. That's
but
fine.
we have
But there's a
list.
lot of other people that want to
We have
speak,
a
and I
list
think they
of
should be
na-
able to speak.
We have a list of names. We're going to extend this up into 1 hour to allow other people to share.
Mm-hmm.
And so that means that we're going to have to wrap things up a little bit quicker. So you want to sum it up, maybe tell us what you want, and I'm hoping DHS is listening to everyone, so that they can take into consideration some of your recommendations about
You want
what
to know
they need
DHS's
to do.
consideration? You want to know what happened to my Chips case? During the investigation, the child protection worker, Donnie Preston with Ramsey County, he had gotten some information from his supervisor at the time, and they told me that I could go ahead and I could have someone around my children and that everything was fine. He gave me the wrong information because his supervisor gave him the wrong information. And then I was not informed that my children were put in sexual danger from somebody who had a maltreatment finding against them, but no criminal case against them. And I didn't find out until we were in court at a permanency hearing when Donnie Preston leaned forward and said, my supervisor gave me the wrong information.
Okay.
She's no longer with the agency, but I'm sorry, I just needed to let you know. And then guess what? They gave me the option to transfer custody voluntarily of my
someone who
children.
would like to ask a question. Representative.
No accountability at all. None. They gave me the option to voluntarily transfer custody with the
gonna wrap
option to
this
come
up.
back in 2 years.
We're going to wrap this up and allow other people. Is there anyone in the audience who needs to leave sooner than later, that needs to speak now? Could you please come? We're going to let him speak. Thank you. Appreciate it.
Do you think we could have another day to come back and speak since
Representative Damon.
everybody's not here?
Representative Damon, would you like to speak? I know you need to leave. Okay. Thank you.
Thank you, Chair. I just wanted to say the conversation that I'm hearing and the comments that I'm hearing today are valuable. The reports that we were provided with in the beginning were a great baseline to be able to learn. I mean absolutely no disrespect to any of you here or the stories that you're willing to share. I can't speak for my other colleagues and the others that are sitting around the table. I know because of scheduling differences, Chair, I know we had to change the schedule. I ended up changing things back in the district that I represent further out last night and canceling and to be here. I mean no disrespect, but I am going to have to leave. But I appreciate the fact that you are here and sharing. I believe this is being recorded. Is that correct, Chair? Okay, I will make that time, and I will make sure that I do continue to listen from this point, but I just want to thank you for taking your time and being willing to be here this morning.
Thank you so much for being
Thank
here,
you.
too. Appreciate it.
I represent District 13A in Stearns County.
Okay.
So I'm Thomas Berry from Black Civic Network. I just wanted to say that all of these children have been stolen from these stories that have been told. and they've been stolen legally from the communities. And it is quite disheartening that people have not made time for these children of the state of Minnesota. I would like to think that the African American Family Preservation Act offers a little bit something different than the Family First Act. The thing is that the Family First Act is offering to drive up costs by therapy and other things, while the African American Family Preservation Act is asking to cut costs from the state. That's two different things. I know last year that there was some things added to the bill that drove the cost up, but that's not the purpose of the bill. The purpose of the bill is to reduce disparities and actually cost the state less money by taking families outside of the home. And I think that that should be our overall focus. If you pay attention to what's going on with this whole process, this is akin to slavery. When we saw the map that was up there by DHS and you look at all the out-of-state places where these children were being placed at, you were taking these children from Ramsey County and Hennepin County, and you were putting these kids in the suburbs with white families where they are benefiting from the foster care acts. That's fact. That's where the money's going to. This is another form of subsidies. This is another form of welfare. We're just not calling it welfare. Matter of fact, if you listen to the testimonies, most of these people are on subsidies to begin with. And what we're doing is we're purging the roles of poor people while giving it to middle-class people who are white in the suburbs. That's where the white supremacy comes in at. So when we're talking about laws and we're talking about the African American Family Preservation Act, I know that Republicans in the Senate, as well as the House, want to reduce the cost of child welfare in the state. That's why they should be voting for the African American Family Preservation Act. I know that Democrats care about the liberties of families and they want to keep families intact. That's why they should be voting for the African American Family Preservation Act. This is not a bipartisan bill. This is a bill that could bring people together. The main piece that every family we're talking about was the lack of accountability by the social workers as well as DHS when it comes to falsifying testimony inside of the courts, which is against the law to begin with. That should be something that people should be prosecuted for. If you are lying under oath inside of a courtroom, and you are separating these families and you're causing harm that cannot be reversed, these people should be prosecuted. We should get them off of the county payroll. The state shouldn't have to pay for that. And as a taxpayer, I believe that we should do away with those types of people. If we're saying that the parents are wrong because they neglect, abuse, or what have you, what do we say to government employees who stand up under oath and lie? We all know that that is wrong. So once again, the African American Family Preservation Act, I believe, will help the state more so than it would even help the Family First Act, because the Family First Act is saying keep the families first. No one is talking about preventative measures. That's what we need. We need to prevent children from being removed from the home, and then we can talk about everything else afterwards. But thank you for your time.
Thank you.
Please introduce yourself.
Good morning. My name is Amy Hullabar, and I come to you from a very unique perspective. I respect every single person that is in this courtroom, and I can understand where they're coming from. My perspective is very unique in the fact that I received my foster care license, my first foster care license in 1999. I have been doing foster care for quite a few years. CPS came into my life because of false allegations, heinous allegations made against me. I want you to remember a number. This number is 624. To date, that is how many days it has been since I have seen my 10 children. Yes, 10 children. My children came into my life through the foster care system. They're still involved with their birth families. 2 of my children have been removed and placed elsewhere. 4 of my children I adopted. 3 of my children are transfer of legal custody, and 1 child who is a sibling to 2 of my adopted children is no longer in my life because of false allegations. Now, everyone sitting here knows that not everyone is telling the truth. In 2018, 86,060 cases of maltreatment were reported, and how many of those were actually valid cases? Every single person here can tell you They know what it feels like to have a rubber stamp put on you from the minute that you're contacted. 624 days were taken from my life and from my children's lives by unsubstantiated, heinous allegations of malicious child abuse. There is, the investigation that was done was biased. There were inequities in the legalities that were conducted. Excuse me, I'm talking and I'm looking directly at you.
Sorry,
I'm giving you.
You are absolutely, and you know what, I'm sorry, I was saying, these stories are so compelling that there's 201 legislators that are missing out on this conversation. And I want, and I was just asking the chair of how we are going to compel these together so that we can get these stories told, because they are moving. They are absolutely moving. And so I'm not disrespecting you. I am absolutely listening to you. I have ADHD and I can multitask better than anybody else in this room. So there's that bird over there. So keep saying what you're saying. I don't have my laptop up in front of me, but I'm asking the chair, there's got to be a way we compile this stuff together, because these stories cannot just be told in this room only. They need to be told outside of this room. And the other, I said 201 legislators, actually 199 that are missing out on this conversation right now. They need to be hearing these stories. So keep saying what you're saying.
The National Association.
I canceled off my next afternoon just to hang out here so I can hear these stories. So thank you.
The National Association of Social Workers has done a report and has put out what is considered their ethics. I can tell you right now, when I look at these people, how do you believe they are following the ethics? Are they following the ethics?
No.
Any of you?
Whoa, wait. So, excuse me. Excuse me. I'm going to have to give you like 2 minutes to wrap it up.
There may be the 1% that is actually in Minnesota is, has the license. Otherwise,
Oh, yeah,
Excuse me,
unlicensed.
Excuse me, ma'am. One, I want to respect the people who wants to talk, who have a story to share. If you're going to talk, you need to be in front of a mic, because we are recording this. And my plan is to make sure, or to share or request that all the 199 other legislators who are not here to hear your stories can hear these stories, right? So I want to be respectful. I want to hear you, but I'm also in my head thinking about how we need to best do that, because the folks who we would like to hear you are not here.
We need accountability for every entity from the entry of CPS into our lives until the resolution of our cases. There needs to be accountability, be it the judges, be it the lawyers, be it the guardian ad litem. These people have rules they need to follow, and they're not following it. And the oversight that just came out speaks volumes to it. Thank you for your time.
Thank you so much. And you know, you guys have powerful stories, but at the end of the day, if you got some solutions so that people can hear what needs to happen, mention those things too. Please introduce yourself for the record. Wait a minute, I'm sorry. Before you introduce yourself, can I get a hand of how many people would like to speak? 1, 2, 3, 4. We have 4 up there and the 3 here. That's 7. All right, thank you. Please proceed.
Hi, my name is Vanessa Lopez. I'm here representing Justice for Lovey. I'm campaigning for the Blue Campaign.
Please speak up a little bit.
I'm campaigning for the Blue Campaign for human trafficking.
Okay.
I've been doing solo activism work by myself.
No, you can
I'm basically here to stand.
Sit.
I'm going to stand up. I'm going to stand up with everybody.
Please sit.
Huh?
Please sit.
I got to sit down?
Mm-hmm.
It'll be okay, just go. I pre-wrote it last night, so I'm just going to read it, and it's going to go quickly. I just took the pinpoints out of my main story. I do have an open CPS case. They're trying to terminate my rights and forcefully adopt my son out. So this is my story. Where do I begin? My name is Vanessa Alicia Lopez. I'm 38 years old. I'm a Mexican-American born and raised from the west side of St. Paul. I have 2 biological children. My daughter is 21 years old, and my son, Ernesto Lewis, is 2 years old. And I have about 9 children that I have been a stepmother and a mother figure to over the past 20 years that I have loved and have treated treated as my own from toddlers and newborn age. Please allow me to intrigue you on my past history as a mother and the style of parenting. My oldest stepson will be 24, and he has kids of his own, so that would make me a proud grandmother. He's been in my life since he's been 5, and he has 2 younger brothers who love and respect me as a mother figure. My boys are victims of childless biological parents due to domestic violence. Their biological mother was in pursuit of a better life and no longer was interested in the relationships with the 2 younger boys' father. January 23rd, 2003, their mother was a victim of homicide-suicide. Although this is my daughter's father's son, who is incarcerated at the time, I took the initiative to step up to make sure them kids would grow up knowing they had siblings. Although my stepson and my daughter's father did not step up, to this day, I'm grateful to have them boys in my life. They were not affected by separation, but they were affected by domestic violence. I continue till this day to be a mother figure to them boys. I began a relationship back in 2008 with a man who has children. The more we became involved, I became a mother figure to his first set of children, babies and toddler ages. Unfortunately, the father is currently serving a unnecessary sentencing from the federal court system in Minnesota. 3 street children became involved in CPS due to their mother's situation. So another 3 did by a different mother. But I was not close to them as I am as the ones that I'm speaking about. At that point, I was on the other side. At one point, I was on the other side of CPS situation where I was trying to gain custody of them 3 children because I was one of the primary caretakers of them children. Until Child Protection knocked on my door and took them from me. They ended up getting adopted out with the mother's maternal aunt, and they are in good care. The last 8 years, I kept a bond in a relationship with them from the maternal aunt's acceptance of who I was and what I meant to them kids. My significant other whose incarceration is coming to an end and is planning to reach out to regain custody of them kids due to the second chance activists and community. When he's released, before he made his mistakes, I can and I will vouch that he was an excellent, loving, caring, providing father. That was my initial attraction to this man. I ask you to keep an open mind of our history of being loving and caring parents. Besides my 2-year-old son, my other biological child is my 21-year-old daughter who suffers from being a fatherless child. My daughter is and has always been a handful for me, but I've always maintained to be the best mother I could. My significant other has really been the only other father figure in her life. She considers his children her brothers and sisters. Before this situation arose with me, I've been a working, productive, non-criminal, non-violent, respectful, and respected figure in these children's lives, which now brings me to the situation why I sit in front of the task force testifying the reason to keep African American families from separating. 2016, I fell into a relapse due to the layoff at a job. Lost my place, I'm sorry. Layoff a job. I was working for the union, making $35 an hour, doing what I do best, cleaning. During this process, I was married, but it was a failed marriage. I thought switching up romantic partners would get me out of the life that I did not want to live no more. Okay. Okay, I'm currently divorced, but to bring you up to September 26, 2017, I was chasing my 18-year-old daughter out of the street life because that's what a loving parent is supposed to do. with no support from extended family members or my daughter's other side of the family, it was easy to self-medicate to get through these times. Which brings us to September 18, 2017. Please keep in mind that I have not had a child in the last 18 years. I continue to have it menstrual, but I felt something familiar in my breast. I took 2 pregnancy tests that came out positive. This pregnancy was something I could not control. It should have fell under the excusable neglect, but that was not the case. September 26, 2017, I walked into Regent's hospital room concerned in the good faith of my unborn child and myself. I needed to know how far along I was because, to be honest, I only thought I was 2 months since the beginning. I've always kept it honest about my story. That day I told the nurse that I had took pregnancy tests, 2 pregnancy tests on the 18th, and I found out I was pregnant, and I reported to her that I had been using methamphetamine because being honest has always been the key in my life. I wanted to get help. I did not want to get criminalized. I did not want to criminalize myself. They suggested during the ultrasound that I was 6 months, which made sense due to the nature of the intercourse unprotected. So with that, within the 2 months that I did know that I was pregnant, I reached out to Mothers First to get proper help. I had did a Rule 25. I was on a waiting list to get into inpatient treatment facility, but due to being a single parent, I was trying to figure out some kind of establishment to help me pay my rent. So
Vanessa, I'm hearing your story.
To get to the point, they're about to adopt my son out. They're forcefully adopting my son. I did everything I was supposed to do for child protection. No matter what I did for them people, it didn't matter. It was never good enough. Do you know how that makes a mother feel?
Terrible.
December 12th, Ramsey Regent's Hospital, physically restrained my son by all 4 limbs with no explanation and medical documentations. This is a form of human trafficking. It's trafficking in a person. They harbored him away from me, okay? There was nothing wrong with my son. There was nothing in his system, his blood or his urine. There was nothing in my blood, urine, nothing. It was presumption positive. I started investigating my own case. This is a case of trafficking in a person, forced labor services for the benefit of adoption services.
Thank you, Vanessa.
They're forcing my son to be somebody else's child. There's money involved.
Vanessa?
I have court next week.
Vanessa, I think I hear, and it's a terrible story, and the way I see your baby, is that a newborn baby? You know.
My whole point is district court never heard me out, just like you're cutting me off now, but it's fine.
Well,
if my son gets forcefully adopted out, Minnesota's going to be really in trouble.
Okay, but there are some DHS workers there, and I would say
I'm past the court. They terminated my rights. My son was turned over to DHS to be adopted out, and now they want me to go to court back next week for permanency. So now you're not terminating my rights? Come on, what kind of system are you guys running?
Well, okay, but thank you. Thank you. Okay, please introduce yourself. One of you can introduce yourself, please.
Yeah, so my name is Alexis Kramer. I'm a single mother of 2 kids who are both in foster care at the moment. I'm also dealing with child protection. I live in Hennepin County, and yeah, what all I can say is child protection is not the best system for us here in Minnesota. Or anywhere. Child protection refuses to show any evidence. They think it's okay to just illegally steal people's children from them without factual evidence that a parent hurt their child. In my case, my youngest was found with a broken ankle, and I had a select few people watching my children, and none of them were investigated. They were placed with a Caucasian family who was also watching my kids, and she was never investigated. And now throughout this whole year that I've been dealing with child protection, I learned that she was betraying me this whole time. Basically, I'm being denied services that I'm supposed to be getting. I've been told multiple times that I will never get my children back because I have mental health problems and because I have a learning disability. Not because my child was hurt, but because I have mental health problems, which is illegal here in every state. I've also have, I fall underneath the Americans with Disabilities Act, which child protection is not following. They're not complying with anything. They lie under oath when we're in court. And they make me feel like I'm a terrible mother when I know I'm a great mother. I've done everything I could to provide for my children. And regardless, even if I am poor, I would do whatever I can for my children. I believe that the Family Preservation Act needs to happen now so we can prevent African American families being taken or prevent the children from being taken from their families. So, because overall, children deserve to be with their parents. Now, unless child protection has actual evidence that someone abused their kids, then yeah, that makes sense. However, in all these cases within the past years, they have shown none whatsoever, no evidence. They just take our children and then they terminate our rights off hearsay evidence, and that is ridiculous.
How long has it been?
A year. Never got no due process, no nothing. I have a right to a speedy trial, never got one.
They in foster care? You
Yes.
haven't lost your parental rights?
No. But they're acting like I have no rights at all.
You need to speak to someone from DHS.
They even filed a TPR petition, and they forced me to sign a case plan that I had no idea what I was signing. As I said before, I have a learning disability where there are certain things I do not understand. And these workers here do not know how to handle people who have mental illness problems either.
Yes, they do, honey. That's what they're doing here. Yeah.
Instead, they're mentally and physically abusing me in regards to my mental health. They're making me fail more.
It isn't right. There's definitely some
It's all
bias in here.
triggering all my mental health. I want my children back today or sooner than possible. I want to learn with them more. I've lost almost 10 months of my youngest.
It's not right. I would say you haven't lost your parental rights. Just keep fighting. You have Khalees back there that's what she does. You're in Hennepin County, I would just say make those connections. I have Senator Hoffman here, who's a strong advocate for the disability
There's no
community.
accountability for our workers here.
And we both are saying here that's not right? There's no predictor of why your kids were removed. So just hang in there.
There's a bias.
Yes,
Disability
it's-
bias. No
yeah.
matter where you're at on this, it's evident. So, Chair, this is.
Please introduce yourself.
My name is Candace Nelson. I'm actually a Safe at Home participant, but I'll give you the county. We're up in Douglas County. My children were in school in Stearns County. My story started November 5th of 2018 when my father was in heart failure. We didn't know how much time we'd have left with him. He died November 22nd, 2018. My 13-year-old and 7-year-old had missed 25 plus days of school as the school would not allow any letters from hospice or anything. I did transfer them to online school. There was 150 miles between my home in Douglas County and Woodbury, where my father had lived. A paraprofessional from the kids' school was calling in false CPS reports the whole time, along with my 20-year-old daughter who was using drugs and being evicted from her apartment at the time. We arrived back to Douglas County June 8th, 2019, and August 2019, I kicked my daughter out for using drugs in my home. August 28th, 2019, my children were removed from my home. No investigation, as CPS was never at my house due to me being a Safe at Home participant. They placed my children with my accuser on an emergency basis with no kinship efforts. I'm accused of neglect and drug abuse. I've had 4 negative hair follicle tests, along with 6 negative urine tests. In the beginning, supervised visit place lied to the social workers about me refusing visits. Lakeland Mental Health, I was sent to do a psych evaluation, which is contracted through with Douglas County. The therapist said, well, you don't have a diagnosis, so let's get your son in so we can bill it under his insurance. When I called to schedule a second appointment in a week for my son so he could get said diagnosis, I had to pay $210 for that second appointment. The guardian at Lytton has told me I should talk to someone about giving me a diagnosis, again, so they can bill insurance. My 7-year-old has the whole time said he never should have been taken and has asked to come home. No one has ever asked him his side of the story, and they ignore anything and everything he says. My children were not allowed to attend any grief services after my father died. We were given those free by Healthy's Hospice for 18 months, but Douglas County will not let my children attend them. My social worker has also entered in the system that I have lost custody of my children, and I have not. In turn, I have lost my Minnesota care and cannot reapply. I was fortunate enough that my father left me some money, so I paid $8,500 for my attorney. I paid $1,000 in court-ordered appointments, drug tests and such that the county will not reimburse me. I have $3,000 plus in gas and miles to go to my supervised visits with my kids. I'm in collections as I got a bill from the county for over $8,000 because I have not provided them a financial statement. I'm fortunate enough that I'm able to pay these, but I've spent my whole inheritance from my father trying to keep up with this. I do have the 6-month review hearing next Friday. The Family Preservation Act is huge, because if we can start there and get little bits of change, then we can change this whole system. Thank you.
Chair, could you just share with me why your children could not go to their grandfather's funeral?
They went to the funeral. The kids and I did it. We were in Woodbury in Washington County from December of 2018 until June of 2019 as I had to sell his home. They went to Camp Aaron as grief services during the summer. When we made it to Douglas County, they were supposed to start grief services October of 19, and Douglas County said no.
All right, thank you.
Thank you.
Please introduce yourself for the record.
Nevis Novell Stewart, go by Novell Nior. My experience with the Child Protection Agency with my children have been through the school system. My kids were never taken away, but I was investigated for 6 months. They do go as far as contacting your child's parent, family members to get a background check on that parent. You know, is the child okay home? You do have to bring your children in an office, and it's embarrassing when there's no evidence. It is scarier for the children when they go through things like this. But my problem is the school system. When there's abuse at school, who do the parents contact? They have their own set of guidelines when children are getting abused. But when we are called on, it's different. There's no transparency when there's abuse in the school system. There's a own guideline of laws. It's the principal telling you, we're going to investigate. Well, my child said she's been touched inappropriately or shaken or hurt. What are you going to do? Who do I call? And it's nothing, and it's happened twice. And it's different when it's us and we're the parents, but if it's someone who works for the state, they're protected under a whole nother class, and it's not transparent. You can call up to the boards all you want and don't get return phone calls, and ask for meetings and don't get anything set up. But why? Why does abuse continue in the school and people have their jobs, but we can go through all the trauma in our children by false allegations?
Thank you. And you shouldn't have to go through that. You should not. Please, introduce yourself for the record.
My name is Shauna Askvig. I'm from Olmsted County.
I have a different perspective. I grew up in an abusive home and traveled through the foster care system myself until I was 18 years old. I am now pushing 38. I've had 4 children, and I have lost 3 of them. I grew up in an abusive home. My mother had custody of my sister and I. She shouldn't have had custody of us. My dad was an alcoholic. My dad fought for us, and he lost. Now that there's been 20-some years of reflecting and bad decisions on my part and learning and growing, and I can look back and I can say, okay, the patterns that I have or that I had are directly related to what the environment that I grew up in. Am I grateful that I got to know both of my parents? Absolutely. I would not be who I am today if I had not had both of my parents. Some people turn out better. Some people go the other way. Sometimes, you just never know. We're all human. We don't all respond to the same thing the same way. So this idea, just like recovery, I'm a 12-year clean from meth.
Congratulations.
Thank you. But recovery is not a one-size-fit-all. What works for one person isn't necessarily going to work for another person, just like all of these cases. And even everybody who's involved was trying to, we want to make it a better system. I don't think that there's anybody that doesn't say, or that sits up here and says, we like it this way because it's given us more money. I don't want to believe that that's true. Yeah. But so now here I am. There's no chance at me getting my children or even having a chance at seeing my children again until they turn 18. But I'm in a position.
Have your parental rights been terminated?
Yes, 2002, 2002, 2006, and 2011.
So I want you to know, I worked for an organization called Prevent Child Abuse Minnesota for 10 years, and what we know is that, you're typical, because people who have been abused will abuse, right? Or you'll find yourself addicted or in bad relationships, but it's not the end of the world. It is not the end of the world. You can recover. You can be a great person and a great parent. It just takes time. And I hear you saying you're working towards that. And just keep doing it, If you know what your children are, and what we also know and what research tells us is that when kids are removed from their homes and they know their parents, eventually they go back to their parents. So you need to be the best person you are when they come back looking for you, because often that is what happens. Okay?
But and that's all good and whatever, but the thing of it is it takes a community, okay?
Yes.
What got me sober?
I believe that.
What got me sober
Village to raise a child.
was having the support people, was having, once I found out I had a purpose, there were people who accepted me. I felt heard. I had something to look forward to every day. Those are the things that I needed in my life in order to become the person that I am today. I have a great job. I own my own land. I'm a farmer. I'm
a strong parent advocate. We know that it takes a village. We all need support. We're trying to go upstream and be more preventative and look at family support. That is what we know helps an individual. So I just want to say thank you. We're running close to time, and I want to allow these other 2 women to
people
also
like
share their
me,
story.
I would love the opportunity. There's nothing that I have more passion about than to help other mothers in particular.
I used to run a program like that, but I'm not doing it anymore because I would be like recruiting you.
That's what I want to do. I want the ability to help people, to bring people into my home so I can show them, hey, this is how I did it. Yeah. This can work for you too.
Absolutely.
How do you do that?
Let's talk offline. We're gonna, ladies at the testifying table, please introduce yourself.
Good afternoon. My name is Jamie Lynn Grubbs, a living, breathing woman of this land. Madam Chair and public servants, I can't really read all the names, but I want to thank you for staying here for these parents, okay? There's a problem going on. And right now is your time to speak for these parents. You are the public servants for the people, okay? They keep talking about no due process. Do any of these parents out here know what due process really is? You make your grievance, you take your petitions, and you bring it to these guys. That is real due process. De facto courts will not cut it. It's time to take the de facto away and replace it with de jure, okay? You guys keep saying go talk to DHS. I'm a court watcher. I'm a defense contractor. I will hold a judge on emoluments violations. There's a racket going on with proof. It's a chain link that needs to be broken. But you four up here, I really want to thank you, but I am very disappointed. And there's no names, I'm sorry. I'm really sorry. Thank you. Because these empty chairs is very disappointing. And parents, for your information, if you want full chairs, you call nothing less than a quorum. Because that is what we need as people. Okay?
Thank you.
Stop telling them to go to DHS. Because they do
They have
nothing.
a choice to do that if they would like to. And so that was my suggestion. People can choose to do what they want to do.
Okay,
So
one more
I'm gonna-
thing, please.
One more thing.
One more
Okay.
thing. If you want due process, just to give you guys heads up, I have 19 remonstrances coming your way.
All right,
Thank you.
Thank you. Please introduce yourself for the record.
Hello, my name is Charisma Smith, and I am here by way of Hennepin County in support of the African American Family Preservation Act. And I want to encourage you to take a very close and sincere look at the African American Family Preservation Act and support it with your full support. One, because I believe that the 5, 6 of you are the ones with the heart of the group. I believe in you because you're here believing in us, and that means a lot. If you support the African American Family Preservation Act, I believe that you will be supporting the investment that African American children need to begin to reconnect to their families, their communities, and operate as civil citizens in our society, a society that our ancestors built literally with their blood, sweat, and tears in bare hands and deserve to partake in. I believe that if you support in the African American Family Preservation Act, you will be supporting the restoration of a community that has been dismantled for the last 400 years by way of human trafficking, and will be beginning to give us reparations. It's not always monetary. Reparations can come in the form of your actions today by supporting the African American Family Preservation Act and telling your peers blatantly and frankly how badly we need an act like this, because the very fact that we have to have a conversation like this should tell us that this is a problem. We need social workers who come from the community of the ADOS, the African descendants of slaves here in America. We need social workers that are able to speak the language of the children and the families that are most impacted by the practice versus policy deficits. We need critical supports from you because African descendant of slave children have been separated from their families for 400 years, and families are labeled, parents are labeled as unfit, while children are labeled as juvenile delinquents, and systems begin to build and rebuild and get bigger and bigger based off of the labor of our families still to this day. How? Because when our children are labeled juvenile delinquents, Hennepin County released a report that said that if a child has one interaction with the juvenile delinquent system one time, he's set on the trajectory for prison. Okay? We need you to support the African American Family Preservation Act. Because you chose to sit here today, I believe that you can. We need you to support the African American Family Preservation Act because we need systemic reform. Too many of the policies that govern our country today was built antebellum, was built before Reconstruction, was built during Jim Crow. We can no longer live under such policies because we have a different thought, right? And here in Minnesota, we believe all lives matter or not. So if we truly believe all lives matter, then we have to believe that an act such as African American Family Preservation Act is needed, and that children of African descendant of slaves deserve the same protection and support as those of our Native American indigenous sisters and brothers. We have to support our children this way. Lastly, we need the transparency and accountability. I've worked in this state for 20 years. I'm an implant by way of Illinois. I am a product of the child protection system. The fight is real. The level of resiliency that was required to overcome all of that in which we go through is real. The separation from my siblings is real. The trauma and re-traumatization is real. And the direct connection and kinship to slavery and auction is real. And so I ask you today, because I'm too proud to beg, I ask you today to tap into that human place in which none of us differ, because we all bleed red, we all have a pumping heart, and we all have a family member that has a black child. Please support the African American Family Preservation Act.
Thank you so much for your passion.
Thank you.
Just my charisma.
Of the African American Family Preservation Act. Thank you so much. You will be our last testifier. So please, introduce yourself.
Madam Chairman, I am Professor Robert O'Connor from Metropolitan State University Social Work Program. We're the most diverse social work program in the state by faculty and student population, and I also manage our Title for E Child Welfare Program, our multicultural child welfare program. I'm also somebody who came out of the system. I lost into the child protection system as a youngster with a older sibling. My parents fought to get me back. My aunties fought to get me back. My grandmother went down to the county office and fought to get us back. Nonetheless, we never returned, grew up outside of the community from multiple failed homes and foster care placements. But why I'm sharing today is today I have worked at DHS, I've worked at our counties, I've worked for the federal government in the Children's Bureau as a technical assistance trainer across our country. I've served as an expert witness across the country and including within the last 6 months here in Minnesota. I also was on the governor's task force, appointed as the only faculty member. One of the things I want to say is...
Excuse me, was that the Legislative Task Force on Child Protection?
Yes, it was. Thank you. One of the things I think that's really important is sometimes when you're sitting back and you're hearing these stories that are traumatic and are impactful, but sometimes folks don't speak the King's English and they don't present the way that we expect them to speak, and so sometimes we discount their stories and that they may have done this or that, etc. But in my work, unfortunately, we do not always have best practice out there. And the last case that I was in, I was testifying on behalf of a family because the county worker was not following the statute, was not following the law. And they were found to not be following the law, not best practice, inconsistency, incongruency, and I knew this because I worked at this DHS in adoption and guardianship, these very same statutes. And so the reality is this family, one, it happened to be an African-American family. And it happened to be a Caucasian family that was trying to adopt the children away from this particular family. But procedural justice, just simply following the law, those sorts of things. I do a lot of implicit bias training within our systems, really important. So I was glad to hear that that was underscored with respect to the Child Welfare Academy. Unfortunately, I wanted to be on top of the list, as you indicated. And one last thing I'll leave you with is in 1992, is really when we became aware of the percentage of children overrepresented in the system of being African-American children. At that time, it was 52% of the children in the system were African-American children, despite the fact that the state population was 3%. And so an African-American specific project was designed because there was an African-American supervisor at Hennepin County, an African-American supervisor at Ramsey County, and the first ever African-American director of DHS, Ms. Denise Rebels Robinson. So a specialized project seeking to meet the needs of the children, African-American children specifically, who one of the counties prior to the inception of that project had only placed 3 African-American children in an African-American homes in the 3 years preceding to the inception of that project. Within the first 15 months of our project, we placed over 180 African-American children in African-American homes. I say that because we had to do business differently. We had to be intentional about the practices, the policies, and the procedures, and the behaviors and the mindsets. And so the African-American Heritage Preservation Act here, we had something similar back then, 1992. I was around back then. Yeah, way back, 80. And it was moved out when I came in 92, but it was moved out in 1994, right, when MIPA came, and Multi-Ethnic Placement Act and the Inter-Ethnic Placement Act, federal legislation. So my point is that this intentional kind of effort needs to be made. Otherwise, we will continue to be in the top 2 of racial disparities in the entire nation. We were number 1 when I joined DHS, number 1, higher than Alabama, higher than Mississippi, higher than every other state, 10 percentage points higher than any other state. Our closest other state was another Midwestern state. I think we're number 2 now. But the reality is that we need to be intentional, and if we are not intentional and counter-cultural in the way that we approach this, these numbers will continue, as well as documented well since 1972 in the Children of the Storm book that talks about this specifically. So that's all I wanted to say.
Thank you so much.
Yeah.
Thank you so much
Thank you
for that history. It's been a long history.
Absolutely.
And so I just want to thank everyone who showed up, for those who presented, for those who came out of town, for every parent, mother, and father, friend, or relative that came and shared their story, their words of wisdom, their insight, and your pain with us today. I'd just like to say that, I heard some common themes from county workers not following the law, lying, removing kids for arbitrary reasons. I heard that kids were removed from their homes because they were abused in their homes in some form or fashion. Some allegations probably true or false. But they also went into foster care homes where they were abused over and over. I also heard that the system that we currently have is not working. And it especially is not working for what the statistics tell us, not only for Native American families, but for African American families. Or maybe we can say it's doing what it was supposed to do. And that is to remove our kids for arbitrary reasons. And so we have work to do. I'm the author in the House of the African American Family Preservation Act. There's also a bill that has been introduced in the Senate. In the House, the African American Family Preservation Act went through the body. And that's important because it allowed many legislators to hear what many say they didn't know what was going on, but now they know. Our hope and our job is to also create an opportunity where we can hear it in the Senate. We introduced a lot of bills around child protection in 2019 in the House, and none of that legislation was heard in the Senate. And a very limited a group of senators in one of the Health and Human Service committees in the Senate. But overall, they did not hear any of those things. They did not know we had conformed to the Family First Prevention Services Act. And so I just want to say that I'm here, Hoffman is here, and those who showed up was here because they have an interest in the subject area. And unfortunately, we cannot mandate someone to show up. Lots of legislators are back in their district. They reported into their district. They're talking to individuals in their district and maybe other task forces committees they're on. I worked really hard to get this moment to be this moment. But we did not all show up. And so it is being recorded. We can do justice to ask them to watch the video, learn from it, hear people, hear the stories, and find out how we can get a hearing in the Senate, but also to shift how we look at engaging families in the child welfare system. And that is do some more front-end support. And even when kids are removed from their home, how do we make it a priority, especially for our black babies, our black children, to be placed with family? Family in our community is foundational. It is who we are and it's how we operate and what we believe in. They need to be with a grandmother. They need to be with an aunt. They need to be connected to their community. They need to be connected to the schools that they were in. I have a bill that I'm calling a comfort call, which is a shift from how we operate at DHS, that will allow a foster parent and the birth parents in the first 48 hours of a child being removed from their home, that foster parent is making a call to that birth parent, as long as it's safe, and they are in communication with each other. So the foster parent gets to ask, say to that parent, what do I need to know about your son or daughter? What are their allergies? Is there a favorite blankie that they have? Can I call you in the middle of the night when they're crying because they're missing you? And then also get an opportunity for that mother or father to say to the foster parent, are they okay? This is what's wrong. This is what they need. And yes, you can call me in the middle of the night when they're crying because they may be missing their parents or their siblings. That is a very humane thing to do that we just do not do and has not been a practice. And also get a chance for the foster parent to say to the birth parent who think that we have a system that's trying to do nothing but take the kids away, for that foster parent to say, I'm not trying to take your child away from you, but I want to keep them safe until you get your child back, because that should be the goal of our system, to get our kids back in the homes with the parents as long as it's safe to do so. But we have not have a system that makes that a priority always. So I want to thank you all for showing up today. I heard Senator Rosen state that she will be holding she will have the gavel. She will be holding the next child protection meeting. It's incumbent to her to figure that time slot out, as we tried to do over a year and a half, or at least the last year. But I say, stay connected. Keep showing up. Keep sharing your story. It matters. Your stories are powerful. And we have a system that we must and we have to do better. And we all know we have to do better for our black children who will one day grow up to be adults, who will become parents one day, maybe themselves. And we know what happens to us sometimes happens again. We repeat that cycle. So we need to have healthy young people grow up to be healthy young adults. But I also need you parents to be strong parents. I need you to be strong. I need you to hang in there and help us transform the system. to make it a better system. Thank you so much. I'm going to gavel out. Be in peace. Have a great Friday and enjoy your weekend. Thank you. We are adjourned.